Good morning, everyone, and welcome to the meeting of the Health Committee for the County of Renfrew and City of Pembroke. It is the appointed hour. I do apologize. Was experiencing some technical difficulties. Have now got those corrected. So I'm calling the meeting to order. As we gather this morning, I wish to acknowledge on behalf of committee and our community that we're meeting on traditional territory of the Algonquin Nation. We thank the Algonquin people and express our respect and support for their rich history. We're extremely grateful for their many and continuing displays of friendship. We also thank all the generations of people who have been careful stewards of this land for millennia. Ms. Hill, has the roll been called?
Yes, Mr. Chair, roll has been taken.
And we have quorum?
And we do.
Thank you. I would invite now disclosure of pecuniary interest and, if any, the general nature thereof, please. I recognize none. Could I have a motion, please, on the minutes of the previous meeting held January 10th, 2023? Moved by Councillor Wilmer, seconded by Councillor Nicholson. Any errors or omissions? Seeing none, all in favor? 1, 2, 3, 4, 5. There we go. Carried. Thank you. There were no delegations at time of mailing. Mr. Kelly, does that continue to be so?
That is true, sir.
Thank you. We do, we don't actually do an approval of the agenda, so I guess we don't need a motion. We are, in fact, I guess I do need a motion to amend the agenda. Mr. Kelly has advised just before calling to order that there is a requirement for a closed session this morning. You will note that that was not included in the mailed version of the agenda. So I would now seek a motion to amend the agenda to include a closed session at item number 11, please. Moved by Councillor Murphy, seconded by Councillor Grills. All in favor? That is carried. As we do not adopt our agenda, Mr. Kelly, I'm presuming I don't need a follow-up agenda, just the addition. Thank you. For those who cannot see, Mr. Kelly has nodded in the affirmative. I am not doing that of my own volition, though.
You are correct, Chair.
From time to time, I believe I have the authority to do so and will. With that, then, we'll go directly into the Emergency Services Department report. Chief Nolan, the floor is yours.
Great. Thank you, Mr. Chair, and through you to members of committee. I will detail items 1 through 6 in today's emergency services report. And then, Mr. Chair, would you like that we hold our budget after the narrative of both of our presentations?
I think that would be the appropriate process. Thank you, Chief. Yes.
Great. Thank you, Mr. Chair. Very good. Thank you. So item number 1 related to point-of-care ultrasound. For a number of years now, the community paramedics have been using point-of-care ultrasound as the technology has considerably reduced in size, complexity, and in cost. So we have been using point-of-care ultrasound. And what we detailed in item number 1 for you was a circumstance whereby the point-of-care ultrasound was able to confirm a bleed in an individual 13 years old who had sustained multi-system trauma. And as a result of that, and are bypassing directly to the Children's Hospital of Eastern Ontario, the trauma team lead felt it appropriate to commend the paramedics for their use of this diagnostic technology and as well for the overall care that was provided. So we thought we'd just share a little bit of information for you on this circumstance. And while the use of the point-of-care ultrasound may not have changed the destination of the individual, it certainly informed and increased the confidence of the trauma team in terms of the need for urgent surgery for that individual, which reduced the amount of time to definitive care. And I think that's very important, as of course they confirmed the findings of the paramedics within the field. So I think that those are really important advancements. And there's also a good reminder in here, and that is for the vast majority of Renfrew County, should you have a multi-system traumatic event, we are not likely to take you to a local hospital. We will likely take you to either Children's Hospital or to the Ottawa Hospital Civic Campus to the trauma center. So you may have constituents come to you and say, why is it that we had a motor vehicle collision in Cobden, for example, and how could they have skipped the Renfrew Hospital or Pembroke Hospital or Empire Hospital with those patients? We take you to definitive care, who have the surgical capability of managing those needs that you have beyond the paramedic care in the field. And that's very important and often confusing for the public as to why would you not take me to the Renfrew Hospital or another hospital in the county. So we do those bypasses in the circumstances of stroke, in the circumstance of trauma, and for certain kinds of heart attacks. And when we look at those heart attacks, like STEMI as we call them, it's a new onset heart attack that is within a time window that allows the surgeons at the Heart Institute to be able to go directly into your heart and remove the clot, for example, put in a stent, be able to open up those arteries at a time when that muscle tissue beyond that clot is open to being reperfused or getting more oxygenated blood to it. And that's why you may have circumstances yourselves or with family where somebody had a heart attack and they were home the next day. The reason they're home the next day is because we've been able to get them diagnosed in the field by the paramedics and to the right place the first time in the least amount of time so that that damage or injury doesn't become irreparable. And I think that that's just an important concept. And POCUS is certainly one of those tools that helps us in multi-system trauma. But there are a number of circumstances, and that's not to diminish the role of the local hospitals. If you were to walk into one of our local hospitals with that same kind of heart attack, chances are the paramedics would be on the doorstep within a few minutes, and we would be on our way to the Heart Institute to try and keep you within that time window. Item number 2, Mr. Chair, related to Ocean Software. So when we look at the investments related to VTAC, of course, they're 100% provincially funded, and the system that we use with Ocean, for example, works closely with TELUS PS Suites, and it's about improving the workflow between the medical receptionist and the physicians at VTAC. It's a little bit behind the curtain kind of activity, but I think important to remind committee and council that we have an important role in the VTAC program, and all of the medical receptionists work for the County of Renfrew. And we transitioned that over a year ago, and that's going exceptionally well. And those VTAC medical receptionists do a phenomenal job. And for them to be able to work more closely and seamlessly with the physicians, we've been able to implement this software solution at a cost of approximately $2,800 per year. So a relatively low cost item, but an important tool within the VTAC services that we're currently providing. Item number 3, Mr. Chair, related to emergency management and the province's release of the Ontario Provincial Emergency Management Strategy and Action Plan. And there's some more information detailed in today's report for committee. Probably important to note that certainly emergency management had a significant role as it pertains to the pandemic. We have done an exercise last year in fulfillment of our requirements, and the province has come forward to ask whether we would be interested in working with them on senior officials and elected officials emergency management briefer by the province. So I'll be working with the CAO and yourself to identify some dates this year where we can make it available to all municipal elected officials and senior officers to be refreshed and briefed directly by the province. This is not something that we will be directly involved in. We're going to simply facilitate the process, hopefully this spring, and hopefully it doesn't flood, but it's probably some timeliness to get ahead of it a little bit for those that are new on their councils. Item number 4, Mr. Chair, are resolutions. And when we look at the ACP tuition loan, essentially what this means is in the past we have since 2008, had an agreement with our bargaining unit members whereby should they choose to go to advanced care paramedic school, that the county would provide the funding as it relates to that education, and that there is a payback mechanism for them to reimburse the county, but they don't need to put that money up front, and that's to a maximum of $15,000. And the loan repayment in full shall be by payroll deduction on a fixed biweekly amount. So Jeff and his team have done an exceptional job of administering this program. When our collective agreement recently sunsetted, this was one of our letters of understanding, which needs to be renewed separately for committee and council. That's a little bit of the information as it relates to that recommendation that the Health Committee recommended County Council that the Advanced Care Paramedic Tuition Loan Program be continued through the 2023 calendar year, Mr. Chair. Item number 5, as it relates to Dr. Cushman and Ms. Lee Levesque. So, of course, Dr. Cushman is the Medical Officer of Health, recently retired, and Ms. Lee Levesque, who is the CEO of Arnprior Regional Health, are two individuals that have done an exceptional job of supporting the VTAC program and as well providing direction to the county as it pertains to access to primary care, but also throughout the pandemic response. So you can imagine the amount of work in the early days of simply managing all of the swabs that needed to go to the Eastern Ontario lab. We were able to do that with the assistance of the Empire Regional Health and using their contracts and their contacts to be able to make that a relatively seamless process. So really, I'd like to thank Dr. Cushman and Lee Levesque by way of inviting them to a future council meeting and present them with some acknowledgement on behalf of the County of Renfrew, the council, and this committee as well, Mr. Chair. And then we're into bylaws. When we look at item number 6, and that is the recommendation that the Health Committee recommend to County Council a bylaw authorizing the Warden and CAO to sign a lease agreement and letter of agreement between the County of Renfrew and Care for Health and Community Services to lease office space at 425 Cecilia for the tenancy of the RC VTAC program. And you may recall that this was previously at Shady Nook, servicing this population in this area, and now that Shady Nook is back up to full speed in terms of community programming. There's a need for greater permanency for a location, recognizing that the province has yet to fully commit to VTAC beyond March 31st, but we certainly have strong signals that we need to continue to operate that program. So we've structured a lease that has a very short get-out clause, if you will, with our partners at Care4, and they've been very supportive in that as well. So when we look at the backgrounder and the costing, it'll be a computed rate at $19.31 per square foot. So, which is, again, 100% funded by VTAC, Mr. Chair, and good accessible space for the population in this portion of the county and the city of Pembroke. So maybe, Mr. Chair, I'll turn it back to you from item numbers 1 through 6, and we will hold on item number 7 as it relates to the emergency services budget until Mr. Blackmore has been able to go through his presentation.
Thank you, Chief. With that, committee, we will go back to item number 1, the point of care ultrasound. Yes, Councillor Nicholson, please.
Thank you, Chair. Just a new guy question. That ultrasound, is it available on all of our equipment, just the ambulances, or also our community care?
Chief Nolan, please.
At this time, Mr. Nicholson, Councillor Nicholson, what we've done is we've rolled it out through our community paramedic response unit program, and we've provided training to some, not all, of that staff at this time, so it's not universally implemented in the service. And the original purpose of it was for it to be used as a diagnostic tool as it pertains to community paramedic practice. You know that our community paramedics also provide surge capacity and do also respond to emergency calls within the community. So in this circumstance, that's how the application of point-of-care ultrasound was used. We are working closely with our partners at the Regional Paramedic Program of Eastern Ontario and the province to move forward with an evaluation project for it to be available on all 911 assets so that it can become a standard tool. Point-of-care ultrasound is especially important because, as you can imagine, when we look at a patient, you can only see so many things. You can smell, you can hear, you can listen to their lungs, but to actually be able to have a window inside someone's body is effectively what point-of-care ultrasound gives us in certain conditions. So it's very useful at identifying blood where blood doesn't belong, or air where air doesn't belong in your body. But it can also tell us, for example, your vascular status. If we have trouble getting an IV, you can use point-of-care ultrasound to be able to watch your IV cannula going into a vein that you might not otherwise see or feel through the patient's skin. So there's a number of different applications, and we've got some very keen paramedics that have recently completed a national instructor program in point-of-care ultrasound. So in many respects, we're leading the dialogue around the utilization of point-of-care ultrasound. Other specialized environments, such as critical care transport, have used it for years, and most emergency departments now have it available to the physicians, where at one time you had to go down the hall to get an ultrasound. Now it's bedside, and in fact, the devices that we're using, they fit in your pocket and they work through one of our iPads. So it's really changed the nature of diagnostic tools very quickly, and something that we want to jump on, knowing that where the paramedics are more confident, where they would suspect a bleed, for example, we know that time is of the essence. And if the patient isn't presenting in a way where they may be otherwise bleeding into their belly, it often can take a while for that to start to show up in their vital signs, for example, or even in their complaints. We can have a quick look inside and see whether bleeding is present or is not present, and then be able to use that decision making and often do a consultation with a physician in terms of appropriate destination.
Follow-up, Councillor Nicholson.
Yeah, thank you so much for that. And it just reinforces in my mind a tool especially good for rural settings where time is of the essence. So I think it's a great investment. I would encourage us to continue to do things like this to be able to project that as close to where the injury is taking place so the decisions can be taken, service can be provided immediately. So thank you, Chair.
Anything further on item 1? Just as an aside, courtesy of Merriam-Webster, auscultation is listening to the sounds of organs in the body. Hemothorax is the presence of blood in the pleural cavity, and pneumothorax is the presence of gas or air or other gases in the pleural cavity. I will leave it up to you to undertake a search of your own as to what the pleural cavity is, but I did want to bring to your attention the definitions of these words. Councillor Murphy.
Any fan of Grey's Anatomy knows that.
Item 2, Ocean Software. Councillor Nicholson.
Yes, Chair, thank you. My apologies for the consistent questioning. I just want to be clear, when we talk about Ocean, is that also the same platform used by hospitals like the Renfrew Hospital, the Ottawa Civic, so that there's interoperability between passing patients' information?
I'll take the first stab. I'm assuming that hopefully that there is an interoperability, because I do know that Renfrew is in alignment with the Ottawa Hospital that utilizes Epic as their health information system. But Chief, perhaps you could be more explicit.
Yeah, thank you for the question. And the follow-on, Mr. Chair, the role of the landscape of electronic medical records is complex, to say the least, and for lack of a better term, is a dog's breakfast in Ontario. You remember at one time Ontario, through a significant initiative, looked at consolidating all emergency or electronic medical records into one. Even within the county, we have those that belong to the Epic family, and those that belong to the Meditech family, and those that have not yet chosen a family of medical records because they're not fully electronic in their documentation. That's the acute care side of the house. So when we talk about the Renfrew Hospital, for example, it aligns, I believe, with the Ottawa Hospital and its Epic program. While Epic has a primary care element to it, it is a hospital electronic medical record solution for hospitals in its current utilization within the county. Ocean is about the connectivity between primary care and the patients. And so where the medical receptionist and the physician and the patient can share information, that's a separate lane than what the hospitals are currently working on. We don't have a solution that provides connectivity between primary care and our hospitals, and some hospitals and other hospitals within the county. And that's why if you were to go to the Empire Hospital and you will receive a login and a password for the Meditech side, whereas if you go to Renfrew, they may provide you a login and a password for the Epic side, and the physicians that work in one hospital can't necessarily see all of the records from the other hospital that are living within the other family of electronic medical records. Because I sit at different tables, Ontario Health is currently looking at technologic solutions that connect those family of products, as opposed to driving everybody towards one or the other, because the hospitals are individual corporations that get to make their own decisions. So some information, like lab information, is often sent to the provincial repository and then can be pulled down over time, whereas pharmaceutical information may be pulled down over time as well. But being able to access your entire medical record will depend on whether you live within one family of medical records versus the other. Ocean is in the primary care family, as is the TELUS PS Suite solution. So we tagged on to what the Arm-Prior Family Health Team was using, our partner at the inception of VTAC, and continued with the TELUS PS Suite solution, because not only is this a repository for information, it also becomes the atlas, if you will, in terms of your healthcare resources that are available in the community. So when we populated TELUS originally, we had to know all of the pharmacies and all of the fax numbers, all of the specialists and all of the information, where all of those community service points of contact are. You populate that in, and then that comes up for the medical receptionist as they put in your address and your location and confirm your pharmacy before our doctors even talk to you within VTAC. So it's unfortunately very bespoke. It's very customized and does not speak well to other parts of the system. But what Ocean does is it lives within that ecosystem related to the TELUS PS Suites, which is a predominant medical record within primary care. It's different than pre-hos, which is what we use within the paramedic service, and which is different than Epic, which is different than Meditech. And I say all of that with great regret that there isn't greater integration across the system. But what Ocean does is provides connectivity within the lane that is TELUS PS Suites, the medical reception, on through to the patients. And that's the best that we can do within that lane without boiling the ocean and trying to solve the broader healthcare issues related to connectivity at this time.
I have, thank you, Chief, very comprehensive. I have, for everyone's information, through Google, Wikipedia explains the Tower of Babel narrative in Genesis 11, 1-9 is an origin myth meant to explain why the world's peoples speak different languages. I think that that's akin to what we're describing right here. Councillor Murphy.
Thank you, Chair. Just as a follow-up to my colleague's comments, everything flows into my chart, though. So it doesn't matter what platform either hospital uses for the patient. I can log into my chart, and it doesn't matter if it came from Arm-Prior, Renfrew, or my doc. Does Ocean speak to my chart?
I don't know. I will find out for you. My understanding is that that's not its intention. However, TELUS PS Suites would connect with my chart. And again, that's the provincial repository, but it is incomplete. It's not your entire medical record. It's only lab values and things that the province has line of sight to. Right? So if we need to know what your complaint was last time you had left upper quadrant pain, that's not in my chart. What's in my chart is your hemoglobin associated with that visit. That's all. And that's critically important because it's the statistical data as it relates to provincial lab programs, for example, not that visit or those experiences. It's typically results-based. It's not the complaint or the evaluation or the examination.
Okay. Thank you. Yeah, I used it for the first time a couple of weeks ago, and I thought it was pretty slick. So that's why, thank you.
If I could, Mr. Chair, it's very slick if what you're looking for is there. Right? And so I don't want to sell magic beans to suggest that Ocean or TELUS or any of the individual solutions is able to export all of the information that might be relevant to a paramedic. So for example, something as simple as a DNR. Right? We have the ability through pre-hos, our record, because if you were a community paramedic client and we took an image of your DNR, it's now stored in our repository. If we go to your home and you're in cardiac arrest, and we're now looking through drawers to find a copy of your DNR to cease resuscitation, that's an entirely different experience than pulling you up in pre-hos in our chart and knowing that there's a DNR sitting there, which can then provide you a more dignified end, as an example.
Thank you. It is curious as well that, and I'm not entirely sure, I think Procter & Gamble might notice substantial uptake in a young woman's purchases of folic acid and will then be sending Pampers coupons in the mail and yet we are in this Tower of Babel with respect to electronic medical records. It does seem that there is a substantial disparity there. Anything further on ocean? Seeing none, moving on to 3, the emergency management and the release of Ontario's Provincial Emergency Management Strategy and Action Plan. I see none. Moving on to 4, could I have, please, a motion on the resolution that the Health Committee recommends to County Council that the Advanced Care Paramedic Tuition Loan Program be continued through the 2023 calendar year? Moved by Councillor Wilmer, seconded by Councillor Grills. Any discussion? All in favor? That is carried. Thank you. Moving on to item 5, recognition for Dr. Robert Cushman and Ms. Leah Levesque. Recommendation that Health Committee recommend that Dr. Robert Cushman and Ms. Leah Levesque be invited to County Council to be presented with a Chief's Commendation and plaque for their contributions during the COVID-19 pandemic and the development of the Renfrew County Virtual Triage and Assessment Centre. And once again, I would seek a mover, please. Councillor Purcell, seconded by Warden Emo. Once again, any discussion? All in favor? That is carried. Moving on finally then to bylaws. Renfrew County Virtual Triage and Assessment Centre. Recommendation that Health Committee recommend that County Council adopt a bylaw authorizing the Warden and CAO Clerk to sign the lease agreement and letter of agreement between the County of Renfrew and Care for Health and Community Service to lease office space at 425 Cecilia Street, Pembroke, for tenancy of the Renfrew County Virtual Triage and Assessment Centre. Once again, I would seek a mover, please. Councillor Grills, seconded by Councillor Nicholson. Any question or comment? I am trying to provide for the time lapse to Councillor Yon that is joining virtually. I see none. All in favor? That is carried. Thank you. With that, I think that as the Chief has suggested, perhaps, and we will still approach these on a departmental basis within the committee, but I think perhaps once we get into the budget discussion, we'll stay in that space. So if we want to just hold this resolution in abeyance, Mr. Kelly, I think that would be an appropriate process.
To you, Chair, that would be fine. That would require you to approve the report, albeit and accept items number 7.
Accepting item 7.
Correct.
Okay, thank you. So I would then seek a motion to accept the emergency services report with the exception of item number 7. That is moved by Councillor Wilmer, seconded by Councillor Weir. Any further comment? All in favor? That is carried. Thank you. With that, then, we will go directly to you, Mr. Blackmore, if you would take us through the long-term care report, please.
Good morning, Chair Donahue, through you to committee. The long-term care report starts on page 242 of your package. And the first 2 items detail bid vacancies for the County of Renfrew homes for the period November 22 to January 23. Where you see decline in the occupancy rate from November forward for each of the Bonachere Manor and Miramichi Lodge. This is due to both homes having released 4 isolation beds each in November. And upon that release, those beds began being counted toward our vacancy rate. In addition to the release of the isolation beds, the ministry sought for homes to restart respite services December 31, 2022. So Miramichi Lodge has begun respite services for 2 beds. At this time, Bonachere Manor, we're still holding on respite services, just given some of the staffing challenges we're having at the moment. Item number 3 gives an account of the wait list for Renfrew County long-term care homes. As is evident, there were 659 potential residents awaiting placement, identifying one of the 9 Renfrew County homes as their first choice of placement. So this list basically includes, well, just as it says, only those individuals that named at least one County of Renfrew home or Renfrew County home as their first placement. So there may be a person that does not appear on that list living in the county who perhaps had identified a preference for a home outside of the region. Item number 4 is what has become the monthly outbreak status check-in, and I'm very pleased to announce that since the last report, there have been no outbreak activities at either of the County of Renfrew homes. We do continue on with our daily screening, which includes a rapid antigen test upon entry to the home. All individuals within the home continue to wear their surgical masks, and of course, there's heightened infection prevention control measures are still underway. Item number 5 briefs the January 31st release of the Health Standards Organization with an eye on filling the many system gaps long known to exist in long-term care, but only amplified in the course of this pandemic. The link to the standards are included in the report. And to note, the standards are not presented as enforceable items at this time. And as Advantage Ontario pointed out, to enact the standards would take considerable additional resources than what's afforded at present. So yeah, in the meantime, both county homes, we're still working toward ensuring that we're meeting compliance with the newly minted Fixing Long-Term Care Act 2021. So we have our hands full with the standards that have been recently introduced. But certainly, the national standards are welcomed as a concept, but implementation may be a challenge. And there is a bit of a link there with the standards in that they indicated that all homes across the nation should be accredited. And I think the committee will recall that both Miramichi Lodge and Bon Hocher Manor are accredited at the highest rating, and we are moving into repeating that, hopefully, this coming spring. And that leads us into our next item. So item number 6 is an update concerning the upcoming accreditation survey for both homes, specifically as it relates to participation for the governance team, for which Health Committee and Council as a whole have a role to play. So the plan is that for Health Committee to complete a governance team survey in preparation for the survey that's scheduled for between June 26 and 28. So that's the final accreditation survey. You'll be getting an email asking you to complete a survey with some instruction that goes along with it. But the survey seeks an answer of met, unmet, or not applicable for 17 governance standards. Standards that are answered as unmet or requiring work will frame the action plan to bring forward for a future committee and council, with the hopes that the plan gets executed such that we can participate and identify that the action plan has been met in time for our June accreditation. So the makeup for the final survey, what we're looking at having is Health Committee complete the survey, do the action plan, have it go through to council, and both the chair of Health Committee and the Warden Emo, between June 26th, 28th, participate with myself, the leadership team of both Bon Hocher Manor and Miramichi Lodge with the surveyors for a final survey, and the CAO as well. Item number 7 summarizes the inspection report conducted by the Ministry of Long-Term Care Inspector Susan Louie in follow-up to care provisions as well as an incident of resident abuse. A written notice was received related to failing to follow the care plan where a resident did sustain an injury during a transfer assisted by one staff when the care plan had called for 2 staff. And appropriate action was followed up with that report at the time. Item number 8 is a resolution for long-term care services. Oh, sorry. Chair Donahue, did we want to stop here? Or?
I think we'll carry on right through, but we will save and accept the budget resolution.
So item number 8 is a resolution for the Long-Term Care Service Accountability Agreement, Schedule E, Form of Compliance Declaration. The recommendation that the Health Committee recommend that County Council authorize the Warden and Chief Administrative Officer Clerk to sign the annual Schedule E Form of Compliance Declaration issued pursuant to the Long-Term Care Service Accountability Agreement for each of Bonnechere Manor and Miramichi Lodge. Did we wish to have the resolution before the background, Chair Donahue?
I think what we'll do is very similar to the emergency services. We'll work our way through. If you want to provide the background, when we come back through the review, I will then read the recommendation again and seek a resolution from the floor.
Okay. So the background is, as Ontario Health advised, that the service accountability agreements for fiscal year 2023, 2024, and associated timelines and activities information, that those will be forthcoming in the coming weeks. However, as per past practice, Ontario Health requires Schedule E Form of Compliance Declaration to be signed for each of Bonnechere Manor and Miramichi Lodge and returned by March 1st. Deadline is attached. Appendix LTC 1. Item number 9 addresses the matter of Bylaw 3722 Vaccination Policy G010, both of which are subject to review March 1, 2023. Recommendation that the Health Committee recommends to County Council to adopt a bylaw rescinding Bylaw 3722, revoking Policy G010, vaccination policy for the County of Renfrew long-term care homes effective March 1, 2023. And the background, the long-term care homes adopted a vaccination policy on March 28, 2022 in response to the COVID-19 pandemic. Current vaccination policy dictates that all staff, essential caregivers, students, and volunteers require 3 doses of COVID vaccine and that general visitors have 2 doses. At present, the 3rd dose of vaccines were administered to the majority of staff, essential caregivers, students, and volunteers over 1 year ago, significantly limiting any transmission prevention utility that may have existed. Further, there is no evidence to support that individuals with current bivalent COVID vaccinations are prevented from contracting and spreading COVID-19. Staff is recommending that the long-term care homes vaccination policy attached as Appendix Long-Term Care 2 be revoked effective March 2023. And if I could just to expand on the rationale to cease the mandate, at present, the greatest utility in maintaining current vaccination status is that of basically mitigating symptom severity. And I can report that the greater majority of our residents and a significant portion of staff have received the most recent vaccination. And that, as I alluded to earlier, that the infection prevention control measures presently in place at both the Manor and the Lodge exceed the minimum requirements, that we do rapid test daily. We wear masks in the home. We actively screen. Item number 10 is a recommendation to revise County of Renfrew Bylaw 8409 concerning smoking on county long-term care homes property. The recommendation that Health Committee recommend that County Council amend Bylaw 8409 to revise long-term care homes policy G009 that removes residents of Bonnechere Manor and Miramichi Lodge from the policy, and further that this policy be reviewed in 6 months and again at 12 months. In the background, Bonnechere Manor and Miramichi Lodge were declared non-smoking facilities by the resolution of Council of the Corporation of the County of Renfrew effective March 31, 2006. Further, on June 24, 2009, the Council of the County of Renfrew passed Bylaw 8409 banning residents, staff, and the public from smoking on Bonnechere Manor and Miramichi Lodge property effective March 1, 2010. The bylaw achieved the intended purpose of eliminating smoking on the property. A significant portion of residents were motivated to quit smoking. Over the years, residents with varying degrees of mobility impairments have endured hazards associated with all weather conditions and vehicular traffic in order to vacate the property to smoke. Some have fallen into sustained injury. Fortunately, to date, no resident has fallen unattended for a duration detrimental to their health. In the interest of resident safety and recognition that Bonnechere Manor and Miramichi Lodge are the homes to their respective residents, it is recommended that the residents be permitted to smoke on the property no closer than 9 meters from the entrance of each home, in compliance with the Smoke-Free Act, Ontario Act 2017. Such conditions are congruent with smoking conditions currently affected the County of Renfrew Administrative Building property. The revised policy G009 smoke regulations and the amended bylaw are attached as Appendix LTC 3.
Thank you, Mr. Blackmore. Committee will return to page 42 of today's report and review first, beginning with the information items. Number 1, Bonnechere Manor resident statistics. Item 2, Miramichi Lodge resident statistics. Just one question, Mr. Blackmore. I wonder if could you advise committee how many respite beds are there at each of the homes?
Through Chair to Committee, there are 2. We've agreed to 2 designated beds for each home.
All right, thank you. Item 3, Home and Community Care Support Services Client Waitlist Information. Councillor Nicholson.
Yeah, thank you, Chair. Just, I'm wondering about a third column in this report. Are there currently residents in our long-term care homes in Renfrew County that are seeking transfers outside of the county?
Mr. Blackmore.
Through Chair to Councillor Nicholson, that is the case. That there, I don't know the number, but there are. Is that a number we'd be interested in tracking?
Any follow-up, Councillor Nicholson?
No, I'm just curious if it's something that's available if we wanted it at a time. I don't want it right now. And the other question, if I could, Chair, is of the 659 folks that are currently waiting for an opportunity to occupy a bed in long-term care, how many would be supported by our paramedics at this point in time?
I think that perhaps would be more, well, either one. I'm assuming Chief Nolan, you might wish to weigh in on this.
Yeah, thank you, Mr. Chair. We have over 1,200 people that we're currently supporting through that program. So it actually exceeds those that are on the wait list. Of course, those that are on the wait list are given the opportunity, should they wish to have community paramedics engaged in their care trajectory while they await the eligibility for beds within long-term care. We've also heard anecdotally from those that are on the wait list that they're prepared to stay home and be bypassed on the placement into long-term care, provided they can continue to receive community paramedic support in the home, which is good from a how do we get to the people who need to be in long-term care, getting into long-term care. And our hope is also to support Mr. Blackmore and his peers in having those entering long-term care in a more stable medical condition once they achieve that. So the precise number of individuals on the wait list and on the wait list, our goal, and Deputy Chief Grenier, who's at the back of the rooms, prime objective has been to reach out to every single one of those individuals, and I think that we're capturing the vast majority of those that are on the wait list for long-term care currently.
Thank you. Anything further on item 3? I see none. On the pandemic update, and as Mr. Blackmore has cited, it has essentially been distilled into outbreak update, so I'm very happy, very thrilled, I'm sure, as are all staff and residents in long-term care. Keeping in mind, of course, that we're also in outbreak status for the legacy respiratory and GI issues. Hopefully that wave of flu has come and now is receding as well. Item 5, HSO National Long-Term Care Standards. Item 6, the Accreditation Canada Survey. Item 7, the Ministry of Long-Term Care Inspection. Just to be clear, I did have a discussion with Mr. Blackmore just on the wording alone. The inspections were on those dates, not the alleged incidents. On those dates, I was somewhat disconcerted when I read that sentence. I read it several times and then actually pulled up the report that the allegations of resident to resident were not over multiple days. The inspection was over multiple days. Moving on to resolutions then. I will read the recommendation and seek a motion. Recommendation that the Health Committee, this is with respects to the, this is the LSA, the Long-Term Care Service Accountability Agreement, and Schedule E, that the Health Committee recommend that County Council authorize the Warden and Chief Administrative Officer Clerk to sign the annual Schedule E Form of Compliance Declaration issued pursuant to the Long-Term Care Service Accountability Agreement for each of Bonnechere Manor and Miramichi Lodge. I would seek a mover, please. Warden Emo, seconded by Councillor Grills. Discussion. Just one question that I have, Mr. Blackmore. So I think it was at our January meeting where we did a kind of a precursor to the MSAW. That was the Multi-Sector Service Accountability Agreement, and that was with respect to the day program at Bonnechere Manor. So are each of these kind of precursors to the actual annual renewal? Because I think that typically is in March, correct?
Through you, Chair, that's correct. There's a bit of a delay in having the document coming this time around.
Okay, thank you very much. With that, all in favor? That is carried. Thank you. On to bylaws then, and this is the long-term care home vaccination policy. Recommendation that the Health Committee recommends to County Council that County Council adopt a bylaw rescinding bylaw 37-22, revoking policy G-010, vaccination policy, for County of Renfrew long-term care homes effective March 1st, 2023. Could I have a mover, please? Councillor Weir, seconded by Councillor Murphy. Discussion. I think that this is still one of the legacy issues, COVID-related legacy issues. I note within the background information, and it has become more and more clear, I think even beginning perhaps in early 2022, that the connection between capacity to transmit based on vaccination status was much diminished. I'm not sure if now it's even statistically significant, and yet it was having an impact on both staffing, that is, and also on the ability, I think, of some caregivers to provide that essential care to their families and loved ones. So I'm very pleased actually to recognize this. It is important to keep in mind, though, as Mr. Blackmore has stated, there is absolutely no question, zero, that the vaccination does dramatically reduce the burden of COVID-19 infection. The severity of the infection for those who have been vaccinated is dramatically reduced in terms of hospitalizations, in terms of severity of illness, and ultimately even in the incidence of fatal infections for those who are vaccinated. That absolutely continues to be so. However, the statistical significance of reducing transmission by dint of vaccination is much diminished now as we have worked our way through this. With that then, in the absence of anything further, all in favor? That is carried. Thank you. Item 10, the long-term care home smoking policy. Recommendation that the Health Committee recommend that County Council amend bylaw 84-09 to revise long-term care homes policy G-009 that removes residents of Bonnechere, in quotations, residents of Bonnechere Manor and Miramichi Lodge, end quote, from the policy. And further, that this policy be reviewed in 6 months and again in 12 months. Could I have a motion, please? Moved by Councillor Wilmer, seconded by Councillor Nicholson. Discussion. Councillor Weir.
Yeah, I just noted on here that it's for residents. Does this apply to staff as well? No? Okay. Thank you.
Mr. Blackmore.
Through your chair to Councillor Weir, and this is strictly for residents. If I could, the premise being that this is the resident's home.
Councillor Nicholson.
Yeah, I just wanted to confirm, Chair, that the same quit smoking programs are available to the residents. And there's no change to that. We're just one small factor in this policy, that's all.
Mr. Blackmore, please.
Through you, Chair, to Councillor Nicholson, yes, those programs will continue.
Thank you. Anything further? I want to commend actually staff bringing this forward. I'm assuming that there was much investigation and research, and I thank you, Councillor Nicholson, for your question. I think the programs provided for cessation, smoking cessation, still continue to be valid and quite useful in reducing the amount of smoking. It is endemic, I think, still in the county of Renfrew broadly. But I think that having certainly driven by often Bonnechere Manor, there was essentially a repurposed bus stop from the 1970s on the corner of the property, as is explained in the body of the background here, that we have, and I certainly think that it demonstrates the power of this addiction, that we have frail individuals that are resident at Bonnechere Manor or Miramichi Lodge, and yet they cannot resist that compulsion, and yet we are requiring them to actually vacate the property. What this policy will, there is still absolutely zero tolerance for smoking within the building from residents, but there is the capacity now not to have to endure the odyssey of particularly in the winter, of going off property. But it is essential that this continues to be so for visitors and for staff. It is appropriate for that, but I think it's long overdue in recognizing that this is the home of these individuals, and we need to weight it as such. And recognize that notwithstanding the health impact of smoking, that there did need to be some mitigation to the policy. So I commend staff for bringing this forward. Without anything further, all in favor? That is carried. Thank you. Finally, then, we were going to likewise, I'm not going to seek a motion, I don't think. I didn't the last time. Once again, I think I have that power. To sever the budgets for Miramichi Lodge and Bonnechere Manor, and we will discuss those in sequence to emergency management. So I would seek a resolution to accept the long-term care report, accepting item 11, please. Councillor Wilmer, seconded by Councillor Weir. Any further and final questions? Seeing none, all in favor? That is carried. Thank you. With that, we are an hour in. I anticipate we're probably going to be at least to that on the budget. Does anyone need a 5-10 minute break? I am getting several nods, so I will declare a recess at 10:24 through until 10:30, so as to leave lots of time for our discussion before Community Services evicts us at the end of our meeting. Thank you. Thank you, everyone. Welcome back. We are back in order. With that, I'm going to go take everyone back to page 5 of today's report, the draft 2022 Emergency Services Budget. And with that, I will once again yield the floor to Chief Nolan to take us through, notwithstanding the 2 notifications that the CAO has provided me, the CAO does have some preamble comments, so I will yield the floor, in fact, to Mr. Kelly, please.
Thank you, Chair, and to those who heard me yesterday, that's fine, you're going to hear me again. So again, thank you very much, but before we start looking at the 2 departmental budgets, I just want to suggest that and acknowledge the hard work that everyone put into this year's budget, finance, of course, and the directors and managers that put a series of hours into these budgets. But coming out of a significantly tough year, balancing the wants and needs of the community as we balance the effects of the pandemic on our work plans, our regular activities are now costing us much more. And of course, no more significant, of course, than paramedic service and long-term care today. Delivering the same services is going to require innovation, creativity, and support from other sources. We're absolutely aware of the effects that any increase may have on the individuals in our community because we too live here. We were challenged to meet all of our deliverables with the targets that were set for us in 2022, but the team has placed before you a reasonable approach for 2023. You will hear about some alternative service delivery methods and some innovative approaches to get to our levy target, some with significant impacts to our operational model. To that end, as noted with the amendment to the agenda, there is a need to bring some of the discussion into a closed session to discuss issues of a sensitive nature. Again, we look forward to actively engaging with all of you on this year's budget, one of our toughest to date, and hope that you can appreciate the thought and time that went into its creation. Thank you, Chair, and I will yield the floor to you and to
Thank you, and I will immediately yield Chief Nolan if you wish to take us through the Emergency Services Budget, please.
Great. Thank you, Mr. Chair, and thank you, Mr. Kelly, for the preamble. I think it sets the stage very well in terms of the deliberations that have gone into what I'll be presenting to you, both in terms of the challenges and opportunities before us and certainly the system pressures. And there is a heaping spoonful of ambiguity and lack of clarity in terms of what will be provincially funded, what will not be provincially funded, and what our trajectory looks like in terms of cost sharing with the province in a number of different program areas. So while we're getting strong signaling in terms of just please keep going, the provincial budget year and the municipal year do not line up in favor of giving us the clarity, but we have been asked by the province in writing to just keep going with our programs, and they will be informing us shortly in terms of their own budget deliberations and timelines. So Deputy Chief Grenier is going to toggle me through today's slides related to the budget. And I'm going to try and start off at 50,000 feet and then get right down into the weeds with you in terms of what's going on within the service. This, of course, is an attempt to not replicate the information that we've given you through the council orientation, through the original health committee meeting in January, and it's a distillation of those conversations as they pertain to today's budget so that you understand the context of the pressures and the opportunities that exist before us. I've also run some new data now that we have complete 2022 data to show you the impact on community as it relates to the services that we provide in a number of our areas. And we do have a newer member from the City of Pembroke on today's meeting as well, so I just want to welcome you. And certainly if you have any questions, more than happy to take the time to answer them because it's a fairly big book of business between myself and Mr. Blackmore's shop. So if there's acronyms that are used or anything you want to cry uncle, please do it through the chair, and I'm happy to answer any questions as we go along. Through that, Mr. Chair, I will ask Mr. Grenier to work us through today's slides. So just as a reminder, what does the Emergency Services Department mean? Really, it's a 4-function shop, some operational, some contract management. So when we look at how Brian's dressed today, you'd think it's all about the paramedic service, and that's what we do because that's the costume that he wears every day. No disrespect, because we all look like that. But when we think about what our areas of responsibility are, they also include disaster management. So the emergency management functions and the community emergency management coordinator legislative responsibilities sit within the paramedic service. Health committee is the overseeing body. So all of you have responsibility to one degree or another to adopt our HIRA, to annually renew our plan and make sure that we're on track. Of course, the last couple of years through the pandemic have been exceptionally heavy in this regard and have taken us down an incident management system model that has really changed the face of the department, but also the functionality as it aligns with our community emergency management plan. So that's an important function. That's everything from pandemic to floods to power outages to you name it. You individually have responsibility as your own CEMCs or emergency management coordinators at a local level. We do emergency management for county assets, county property, county responsibility, but we also assist in coordinating multi-municipal responses, such as the Derico coming through, or a tornado, or flooding up and down the Ottawa River and tributaries, so as to support and not overstretch individual assets. You can imagine that if 5 municipalities are all phoning Lee to say, I need this or I need that, that's when we stand up our EOC and say all requests come through centrally, and then we work at supporting a more complex environment through that process. Certainly the paramedic service is going to take the lion's share of the conversation as it relates to today's budget, but not to be overshadowed by the fact that we do have contract management responsibility for 911 CERB functions within the county for your municipality, so you get a bill annually from us based upon the contract that we hold with our CERB provider, which is the Ontario Provincial Police out of North Bay. So when someone calls 911 in Renfrew County, that phone call is supposed to go to North Bay, and the OPP simply says, please fire paramedics, and from there knows your geographic location or asks you, should you be on a cell phone or other technology such as VoIP. That then gets downstream to the individual agencies that we've pointed it towards. So for paramedic services, the paramedic dispatch at Renfrew, managed by the province. In other cases, it goes through, in fire service, for the most part, goes through the Renfrew Central Ambulance Communications Centre as well. Armprior has chosen to point their services to an alternate service provider outside of the county, and then the OPP take care of their business internally, but where there may be city police, such as Deep River, we also have the MPs, we also have Atomic Energy, and a number of other agencies. We work through those with the CERB as that pointy edge of that wedge. Fire communications contracts, so we have the responsibility for managing the contract with the province for the dispatching of all fire services, save and except Armprior and Head-Clare Mariah. Head-Clare Mariah has given us alternate instruction, and Armprior has chosen an alternate provider for their fire communications services. So when you look at the next slide, just giving you a little bit of a breakdown in terms of what does that mean. So how many fire-related calls are being circuited through the dispatch center for call-taking functions and dispatching functions by municipality or fire service within the county. So it just gives you a little bit of a snapshot. Individually, you'd probably know your own numbers, but to look at what that aggregate looks like across the county, we're looking at about 1445 in terms of total number of calls handled by our dispatch center and call-taked or dispatched through to your fire services, just to give you an idea. Next slide, Matthew, if I could. From a paramedic service perspective, we've certainly worked hard to align ourselves both nationally and provincially in terms of the tenets of providing paramedic service. We're not just out there doing our own thing. We're not just waiting for telling us something to do. We're moving it forward. So on the next slide, just as a reminder, the Eastern Ontario Wardens Caucus and the Ontario Association of Paramedic Chiefs identified to the province how paramedics could and should be used. I would say that your paramedic service exemplifies a very strong degree of collaboration across sectors and in assisting in leading the conversation around innovative best practices so as to protect our 911 resources, which are 50-50 funded, versus those other services, which is virtually everything outside of the 911 response envelope, is 100% provincially funded. Important to remember as it pertains to today's budget and as we walk through it. So when we look at the paramedic service, what does it mean? To some, this may be familiar. We have an operations section headed up by Brian Leahy, who's also responsible for logistics, and Deputy Chief Grenier is responsible for clinical programs and professional standards. And in that envelope, virtually anything that's 100% funded in community programming goes through Matthew's shop. All 911 operations logistics functions go through Brian, but operations and logistics also support so as not to duplicate the efforts within clinical programs and community programs. And then, of course, administration and scheduling is the unsung hero in all of that. We work very closely, obviously, with our administrative team. Scheduling is a huge piece of our business from a collective agreement perspective, but we also rely heavily on our partners in corporate services, development of property, and others to be able to backstop the expertise required, whether that be in finance, HR, IT, occupational health, and as well from a development and property, because the county is also our landlord in many circumstances, Mr. Grenier. So what does that look like? From an emergency care side of the house, we have 911, interfacility transports. Our Sierra team is an important part of our risk management strategy as it relates to austere environment. So whether that's chemical, biologic, radiologic, nuclear, explosive, on through to working in the bush, ice rescue, and the like. So they represent an important risk management tool. And then we also have paramedics who are now working in both the Pembroke and the Arnprior emergency departments, 100% funded by those facilities to be able to support patient flow and care within the departments. That's been, as I heard yesterday from the CEO of the Arnprior Hospital, very successful, not only in keeping the doors open, but also in managing the relationship and the flow of those patients between our organizations. And then on the other side, we have funding 100% from the Ministry of Long-Term Care. We also have funding from the province and the High Intensity Support Program. And we also have funding for the Renfrew VTAC program. And then we also have response units. And you may think back about 10 years ago when we had a conversation about adding a paramedic station at Cobden. And at that time, it was decided that what we would do instead was the county would fund 2 community paramedic response units to be able to assist in managing some of the call volume, especially in the Griffith. You may remember the Denby conversation, Mr. Warden, and as well on through to the Westmeath La Passe, where we've historically been challenged in terms of providing adequate response time and coverage in those jurisdictions. So that makes up essentially what the paramedic service is and the way that we function. A little bit of a blast from the past for you is this is what it looked like in 2016. So in those areas of green, we had a predicted response time. So we took every square kilometer in the county and we looked at what our actual response time was to that square kilometer for all of the reasons that people called us into that area. And those that are green are typically between 6 and 12 minutes. And then when you start moving into the orange, we're looking at 18 to 24 minutes. And then those red areas are those that exceed 30 minutes in response time. So you can see that we certainly have had a challenge in some of the outer areas. I'm sure all of you are looking for your square kilometer and what it means to you and to your residents. But when you look at that, and I'd ask you just to focus on the orange and the red for a second, I'm going to flip to the last 4 years response time. So we're going to do that slide now and look at the shift in how we've consolidated our response into our towns and cities within the county. But as a result, we now have significantly greater response time or longer response time into those areas that are not covered in our towns and cities. So we've had a degradation, if you will, based upon the fact that when we used to have everybody at base at certain times and we were able to cover off those towns and villages, we did well as well covering off the rurality associated with those base stations. We've had a significant shift in that we're continuing to service those larger cities, albeit not even as well as we did. And you may remember the last presentation I gave about the increase in time on task and the increase in number of calls that we've received, but what that translates into is a significant increase in our response time, particularly in our rural areas. When you have 1, 2, or 3 paramedics available for 10,000 square kilometers, it gets exceedingly difficult to cover that off when it's taking 50% longer to do that individual call and that those resources are not as immediately available. So just an illustration for you as to what we're talking about when we talk about our service level and our actual response. This is not predicted. This is what our actual response was to every one of those square kilometers. So what does that mean in terms of our system pressures? So we know that our emergency calls dispatched have increased by 8.15% from 2020 to 2021. We've seen 10% year over year for the last 2 years. That's unheard of in Renfrew County. That's low in most other municipalities. The reason we've been able to temporize that is based upon the involvement of community paramedics, community paramedic response, and the 911 paramedics that have been working exceptionally hard to be able to meet those needs. When we look at it though, and our time on task has increased by 30.7, so that means with what used to take us 60 minutes is now taking us almost 90 minutes to accomplish for the reasons that we've previously discussed. And when we look at that, we have stabilized the number of out-of-county transfers to an average of 5 a day, but that's still 5 units that are gone for hours at a time. That's a challenge that we've been working on with our hospital partners, and that, frankly, we're at the best we can do right now, but that may obligate further conversation. When we look at the overall staffing pressures, we saw lost time up by 44%. A lot of that was due to the fact that if you as an individual had to stay home for 5 days, healthcare workers had to stay home for 10. So we had to obligate a higher standard for our staff as healthcare workers, which kept them out of the workplace for a long time. Bev and the staff in occupational health did an exceptional job of case managing those files to bring people back into the workplace as quickly as possible, as safely as possible, but there was a significant pressure within the service as a result. So when we look at that in the overall unit hour utilization, we're almost at 40% for what should be 20% utilization. So what that's telling us is if we should be at 20% utilization, 80% availability for the next emergency response call, we're actually sitting at almost 40% utilization, which means that our availability for that next call isn't there, which means it's going to take us longer to get to that call, as those previous maps had shown you. As well, we had a significant pressure as it relates to the actuarial costs for WSIB, and Mr. Foss and his team have worked very closely with us to be able to understand the drivers associated with those costs. We're very happy that our partnership with Frontline Resilience and our psychological team has all but stalled those costs for a number of years now, but there is an actuarial catch-up period that we're working through. So you'll see in the budget specifically, and it's probably one of the greatest aberrancies within the budget, is that we have had to move $621,547 from a reserve fund into the budget to cover off the year's actuarial cost. This is not an ongoing cost. This is a number of years catch-up that Jeff can explain in detail to you in terms of the methodology. But when we look at that, we feel confident that the work we're doing with Dr. Gray and her team and the peer support team is doing an exceptional job of managing new PTSD cases, which are presumptive legislation. And at the same time, we're in the process of managing our WSIB liabilities for previous cases, which may have multi-year consequences in terms of the financial load going forward. The staff that we have now are accessing the services that we're providing at a high rate. That's a good thing. The whole idea is to get ahead of it and to prevent people from suffering the consequences of PTSD. And from a financial perspective, there's a financial cost associated with that, both through WSIB as an administrative cost, but also to the individual and the replacement costs in the workplace. So our budget reflects that WSIB transfer from reserves to be able to cover that off. And Craig and Jeff and the team have worked hard on trying to blunt the wave of pressure associated with that. And at the same time, we're going to continue our investment in our psychological support of staff so as not to further injure within the workplace, knowing that we're at a very high rate of I would call it burnout within the healthcare system overall, and certainly our staff are not immune to that. I used an illustration the other day with a chair where there used to be a bit of a sine wave, a bit of a pattern to healthcare demand over the years, and that was seasonally you would have flu season, so there would be a high demand, and then you'd come down into the spring, summer season, and it'd come down and everybody could catch their breath and then go up. It no longer looks like that wave pattern. It actually looks, for the last 5 years, like a set of stairs. and it just keeps going up and up and up and up, partly due to seasonal factors, but my belief is that it strongly correlates with the age of the population. And with advanced age comes an exponential utilization of health services, including 911 and the paramedic service. So that's why we're working with that vulnerable population to try and manage that, and that's why we've only seen an increase of 10%. But I can assure you that that's no consolation to the people that haven't had that reprieve since about 2017 on the front line. So that's tipping us into the point now where we're at a point where we need to have a serious conversation about adding additional resources to be able to manage the 911 side of the house, and how do we best utilize the resources within the system to be able to support the population who would traditionally need paramedic and 911 services. There are other pressures that we are not immune to, such as the increased costs of fuel, vehicles, materials, supplies, medication, safety equipment, and PPE, as you can imagine, has jumped significantly since the pandemic. We also have utility pressures, as we all do, but these pressures are year over year on our budgets now. And when we look at cost of living and inflationary costs, when we do over 1.2 or 1.4 million kilometers a year on our fleet, that's all diesel. Diesel is exceptionally expensive, as is gasoline, and those are pressures that we need to be able to account for, making an assumption that they're going to come down, but we don't know by how much. So, sorry, 2 million this year? We hit 2 million this year, so it's not 1.4 anymore. So that's a lot of kilometers on a fleet that relies upon that. We do have a partnership with our friends in Public Works, where we now share diesel tanks and diesel contracts to be able to maximize the savings on that. But even at that point, it's still a considerable question mark in terms of what our utilization will be compared to where those costs will be sitting going into the new year. And then lastly, one of the significant issues for us is vehicle shortages. We've not yet received last year's vehicle allocation from the province, so we're still short 6 ambulances, 6 vehicles from last year that we had put into reserve for. The vehicle manufacturers are now saying you require a down payment to retain your place in line. This, as I've discussed with the CAO, represents a different conversation for committee, and that's why you're not seeing it today in the enhancement column, because really we're into multi-year budgeting now for things that we know we need to down pay this year, but we're not going to receive this year. In the past, that was a bit of a faux pas to be able to look at multi-year budgeting as a baseline expectation. We are there now. So if we are going to defer, which we have 5 ambulances from this year's budget to try and be able to maintain our cost control, we also still need to be able to budget or allocate for the down payment of those 5 vehicles at 30% of the total cost. So on 5 vehicles, that represents about $500,000 in pressure, if you will, as it relates to holding our place in line, knowing that we're going to get last year's 6 probably this year. I think they're talking fall. But if we don't hold our place by doing the down payment this year, we're not going to receive the vehicles last year. That creates other issues for us from a safety perspective, from a cost in managing those vehicles perspective, and even our regulatory obligations in maintaining vehicles within kilometerage and within age for the safety of the public. You know, remember what an ambulance does. You see them ripping up and down the highway. It's not something that can be held together with duct tape. It needs to be well managed, well maintained, and to do it in a way that's both cost effective. So those are the 2 main issues within the budget: is how do we look at the pressures in the system and the need for additional 911 resources. And then the second one is, what does that mean in terms of our vehicles and holding our place in line? Because really, as Craig pointed out to me, that's multi-year budgeting. We need to have the conversation at committee about multi-year budgeting by holding place through a down payment this year, which is an obligation through our manufacturers. And it's something that we did do last year as a kind of a one-off, but now it's become a regular course of business, knowing that we're not going to receive the vehicle in this fiscal year. So when we look at where our priorities are, certainly I've tried to align this with the conversations of the strategic plan as well, and as Mr. Kelly has encouraged us to keep an eye on that strat plan and that conversation we had with yourselves, knowing that it's still in draft form, but advocating for sustainable funding for community paramedic and long-term care and the high-intensity support program. We have an additional year of community paramedic long-term care funding commitment because it was originally a 3-year plan. High-intensity support is annual. We've received a letter from the province that says, just keep going. Please don't stop. We will get you your funding letters. So this is how it works sometimes, as you know, when even my base budget for paramedicine isn't confirmed for 9 months into the year. There is an acknowledgement that this is an important program and needs to continue going. So again, it's a risk conversation, but one that when we talk about the patients that we're managing in the community, and for all of the years that this has continually happened over and over, we continue to petition for sustainable funding. We don't want to do year by year. We don't want to do pilot for something that has well proven itself. Expanding the community paramedicine program through innovation, certainly our partners in palliative care, but also our partners in the Ontario health teams as they continue to emerge from being transformational to transactional. We see the community paramedics playing an important role in assisting that population. Models of care is a very important conversation for us, so we are actively involved with the province in redefining the relationship between communities and paramedics. Just because someone calls 911 should no longer mean that you're going to the hospital. When the paramedic can provide you care in your home and stabilize your condition and then help you navigate the health system in a way that makes more sense for you, more sense for the health system, that allows us to be able to provide you better care, keep you at home, and connect you with important services such as VTAC, primary care physicians, prescriptions, right up to and including referrals to specialists. That, to me, is the 10-year horizon of where we need to get. The province, through Minister Jones in May, announced that the province will be moving towards new models of care for paramedic practice, exactly the way I describe it to you in terms of our aspiration. The province recently went through the consultation period and has released the documents that allow this to now occur. So now we're working with our local base hospital and our partners in Ottawa. Matthew and Commander Libby were down doing training in Ottawa this week, in fact, to be able to enable the paramedics to keep you at home safely. The rules today say that when you call 911, the paramedics need to tell you that you have to go to the hospital. And if you don't, you literally have to sign a Miranda that says that you're releasing the liability of the paramedics and the health system and that you're doing it against their advice. That is extortion by any definition, by saying that you have to do something when really, as individuals, we should have self-determination for our healthcare. So when we look at the models of care, that means less transports to hospital, less tied up in hospital, more people in the home, and then we need to find alternate methods by which we can care for you in your home. Community paramedicine, remote patient monitoring, and maybe even alternate transportation options to get you to your doctor's appointment or our clinical assessment center than tying up an ambulance for all the reasons that I showed you in those previous maps. So we are working this through, and this isn't a panacea. We're on the doorstep of this becoming a cultural change, both for the paramedics and for our community in terms of accepting that level of care. When we look at our 911 response capacity, we are seeing multi-year increases. These pressures have surmounted any of our expectations at this point. I think we need to have the conversation again of what does it look like to add additional resources to the 911 side of the house, allow the models of care to work themselves up in hopes that what we're able to do is then be able to meet our response time requirements by the province and set by council, and do it in a way that allows us to be able to decrease those pressures, but provide real solutions for those people who need paramedics within a short amount of time and transportation to the most appropriate destination for definitive care. We talked a bit about bypass earlier and so on. We need to think holistically about what this represents. And when we look at the map and certain areas within the county, we can see that they are now predictably underserved in comparison to even their other rural neighbors, let alone their suburban and urban neighbors. So that's a much bigger conversation, Mr. Chair. But it does harken back to the conversation about what are our departmental needs in terms of the Cobden, Eganville areas, Whitewater, Bonnechere Valley, and those areas that are in that swath in the middle that are continue to be a challenge in terms of our overall coverage from a deployment perspective, because Eganville is actually one of our busiest ambulance crews in the county, but they ping pong all day long, filling everybody else's holes and not necessarily serving their own community. and that's one of the challenges and one of the things that we need to look at backstopping. As well, establishing with the province, having a commander in the dispatch center to manage issues of overtime, of meal breaks, of staff relations, of hospital relations, and so on. The province gave us a letter a month ago agreeing to have a commander in the dispatch center. So we are rotating commanders through the dispatch center, working directly with the provincial staff to be able to mitigate some of those pressures in a very time-sensitive way. That's going exceptionally well. You do not see an ask for an additional commander. We're placing one of our commanders at different times within the dispatch center to cover that off as a trial period. When we go through that process, we'll see what that looks like in terms of a longer-term solution. Sustainable funding according to the strat plan of the county for the Renfrew County VTAC model, and then advocating for paramedics to being a part of the regulated health professions, which allows us to work at full scope. Really, it's a no-brainer, but it's something that we continue to advocate for and try and work that through with the province as well. So, Mr. Chair, I'm going to leave it right there and happy to answer any questions as you wish. In terms of the numbers themselves within the document, I've covered off most of the highlight areas without going through the individual lines within the report. I've identified where we have cost of living increases, where we have inflationary pressures, and the biggest thing within the budget overall is the WSIB cost, where you can see that we've pulled that from reserve to cover that off as a one-time expense, Mr. Kelly. I think was the language that we used. And in doing so, been able to mitigate many of the other pressures within the budget. So we do have some what I'll call cost of living increases, which are based upon our last year's experience. And we have also received word from the province that they will also be funding COVID-related expenses at least until the end of March 31st. So I expect that we're going to get a late announcement from the province to be able to cover off any additional increases related to COVID costs before their fiscal year end, which should come to us within the next 6 weeks, Mr. Chair.
Sorry. Thank you, Chief Nolan. I wonder, just from my perspective, of course, so there is on that top line, and I note, perhaps, I'm not sure if Mr. Kelly or Mr. Foss wishes to speak to this. I will certainly attest to the new councillors in the room that I am unfamiliar also. This format that you are seeing is certainly adjacent to the formats that we have previously seen, but there's a few extra columns this year from my perhaps layperson's perspective. It is with an intent, I believe, to identify what the real drivers are, and then what would have to be put into effect to try and keep it to within the long-term financial plan's direction of operations only increasing 2.5% per year. But if either Mr. Kelly, you or Mr. Foss wanted to speak just to the format that we're looking at.
And it might be both of us, Chair, and I'll tee Jeff up as I did yesterday, I guess. So absolutely, Chair, and good on you for realizing that. It is different for those returning members than what you have seen. There is one or two additional columns. So looking at the budget starting on, give or take, pages 18, 19, you'll note last year's budget, of course, in 2022 is listed there. And I'll simplify it saying, if we were to do all things that we did last year, this year, this would be the dollar amounts associated with that and the increases. That came in, I don't have the numbers here, but it came in quite a bit higher than the 2.5% cap that was by resolution of County Council last year that we bring forward to it. So through a series of suggested implications, I won't say the word cuts, but it may have been, staff reviewed it to identify areas where different models or efficiencies could happen. But I don't want to suggest these are ones like I did yesterday. I don't want to suggest that these are staff is raising their hand saying, we have no problem cutting hours in the Eganville base. We have no problem doing these suggested things. These are, we had to get to the level that you had put upon us at the 2.5%. So we tried hard and identified areas where There may be flexibility to move around these items. The other inflexible items stayed the same, but these ones with a little bit of flexibility were listed in there. And that's my simplified version. Jeff, I don't know if you wanted to add anything to that, Chair. I'll pass it to my colleague.
Thank you, Mr. Kelly. Mr. Foss.
Thank you, Chair, and through you, I think this CAO has really kind of covered this topic fairly well. Our attempt at this format of the budget was to provide a comparison of our status quo position, if you will, for all of our departments. Essentially, the cost of continuing in our operations with the same level of service that we have now is we call it the 2023 budget baseline. And so for the paramedic service 911 program, that budget baseline, if we were to continue operations as is, runs into about a 16% increase over the budget from 2022. And as Craig said, in the fall of 2022, the outgoing council provided us a target and asked us to come up with a budget or business plan which would achieve a 2.5% increase as a maximum for 2023 over 2022. So what you're looking at in that second or third column over from the left is our pressure column of what we would have to do in service level reductions in order to achieve council's targets. For the paramedic service position, primarily you're looking at salary and benefits, cost reductions, $370,000 in salaries and another $164,000 in benefits. That is the removal of one 12-hour night car from our service. And so that is 8,760 hours of 7 p.m. till 7 a.m. coverage for one of our cars. Farther on down toward the bottom, of course, that doesn't quite get us to where we need to be as far as hitting the 2.5% target. So in addition to that, we have as Craig mentioned, we have a pretty significant WSIB increasing cost or expense for our paramedic division. It goes back to 2016 when the province of Ontario made a decision to implement PTSD coverage, presumptive PTSD coverage for police, fire, and in 2016 paramedic services. That certainly has driven our WSIB costs increases. Since 2016, they have been substantial and dramatic cost increases related to that change in legislation. What we've had to do in our 2023 budget was increase our WSIB expense as a percentage of payroll from 9% up to 15%. That's a 6% increase. And on $10 million of paramedic salaries on our 911 program, that's $600,000. So what are some ways that we came up with to try and mitigate this? We do have a WSIB reserve. It's a general WSIB reserve in the amount of $621,000. And so the decision was to put before this committee and all of County Council the opportunity that we have on a one-time basis to attempt to lower the cost and lower the pressure on the levy would be to utilize that WSIB reserve. You'll see below that, of course, the City of Pembroke is obligated to match our costs, and so it would be a levy against the City of Pembroke to be able to contribute to this this plan, if you will. And by those two factors, the elimination of a 12-hour car and the one-time use of the WSIB reserve, we could bring in a budget for paramedic services at the 2.5% target. So what are we going to do on a go-forward basis? This is one-time money that we would utilize. Well, the funding model that the province has for paramedic services is that based on a council-approved budget in 2023, they would attempt to match in 50% dollars our budget in the 2024 year. So there's always a lag. They're always behind. But getting us through 2023 in this fashion allows us to count on 50% dollars from the province of Ontario in 2024. So there'll still be a tail to this. There still will be 50% of that cost as a pressure on us in 2024 again. But this certainly are the two big ticket items that we are providing for this committee to consider in getting us to achieve our goal of a 2.5% increase. Hopefully that answers the question about format at least. So it's 2022 budget, 2023 budget status quo, what our proposals would be to make some reductions to get to the target, and you'll see the second column over is the 2023 budget, and it does achieve the 2.5% goal as directed by Council.
Thank you. I'd like to clarify too, so there are, I'm not sure how many elements there are to the long-term financial plan. When we get to budget workshop, committee and by extension council, of course, we'll see, I think that there might be 8 or 9 elements on the scorecard that we look at. So from the time that the LTFP was adopted in April of 2015, the only thing that has been at variance with that plan beginning in 2019 through 2021 and 22 was the levy target. So council has adjusted the levy target from the plans required or called for 3% over those years. With respect, however, to operational increases, that is, council simply affirmed through the long-term plan of the annual operational increases restricted to 2.5%. In fact, the discussion, though not in the plan, was that they be maintained at 2, but should not exceed 2.5 at the outside. That is contained right within the long-term financial plan. So certainly council affirmed that through the long-term plan, but that was not set by council in September. The levy target was adjusted from the plan. So having said that, I'll begin with Councillor Murphy, and then I will go to Councillor Nicholson.
Thank you, Mr. Chair. So I'm very concerned. We just heard the chief say that Eganville is the busiest base, servicing, as the geographic center of Renfrew County. Yet all the hours, the night hours, are being taken away from the Eganville base. And what I don't see in this budget is the 370 and the one, call it 530,000. I don't see the offset revenue from the province. So is this solely levy dollars? Because the operating subsidy from the province remains exactly the same. So that dog doesn't hunt.
Sorry, I'm not sure. Mr. Foss.
Thank you, Chair. So as I alluded to earlier in my discussion about using WSIB reserves one time to get us through this year, because next year there's a catch-up, the province of Ontario is providing us funding in this budget, and if you look a little bit closer toward the bottom, you'll see $9,647,743. That is the 50% share of our cost from last year. And we will not get one nickel more from the province, regardless what we spend in 2023. That is their funding policy, to always be a year behind and to fund 50% of what this council approves. So you throw some skin in the game, and so does the province, but they are a year behind. So with this this cost reduction strategy, there is no impact on the province's share of this. They are basing their share on what came last year.
Follow-up, Councillor Murphy.
But then wouldn't it behoove us to put this in the budget so we get 50% of that next year? And again, I'm going to put it to the chief, why are we taking all the hours out of the Eganville base if it's the busiest base and they're all over the place?
just before I hand that over to the chief, that is ultimately what is being presented here. So it has been consistent for quite a number of years. The 50% that the province pays is always a trailing indicator. So for those particularly that are new to the council, inclusive, of course, of Councillor Purcell, your Pembroke mate certainly sat through the discussion about the WSIB. So coming out of the actuarial reports were completed on a triannual basis every 3 years. There was one done in ending 2018 that we saw in 2019. The one ending 2021 we saw in March of 2022. In those instances, in both of those instances, it was determined, beginning with the first one in December 31, 2018, that particularly driven by presumptive PTSD, we had been using a burden factor, or the actuarial report of that year identifies that we'd been using a burden factor, that is the payroll factor, the percentage of the gross payroll for WSIB costs was 2.2%. So in that report that came forward at that point, the burden factor that was evaluated was 9%. Now, in any of those years, I don't know if that necessarily matched what each of the 3 years may have been, but that's what was reported. So for the council that was sitting here in March of last year, it was determined that I think that the burden factor that was being used in 2018, immediately prior to this, might have been 7.15. Ultimately, that left a pretty significant gap, and the gap not entirely the exclusive domain of the paramedic service. It also included both long-term care homes and the Renfrew County Housing Corporation. I think there are 4 or 5 business units, if you will, and general is also contained therein. So ultimately, the largest driver was the paramedic service. But I think cumulatively, and correct me if I'm close enough, I think that's okay, Mr. Foster, correct me if I'm grossly inaccurate, it was about $4 million. It was about a $4 million gap in being actuarially solvent for the cases that we had, but also a not small, but I think it was about a 30% forecast of increasing requirements that were already essentially forecast. So we are required to be whole. So that $4 million gap ultimately coming out of the 2021 county and city fiscal years, certainly at the County of Renfrew, we were going to recognize pretty substantial surplus. In fact, we ended with a slight deficit, something on the order of $410,000, $420,000, because we took $4 million of the surplus to make ourselves whole. That's what happened then, but that happened out of surplus, and the province never participated in that because it was never in the budget. So the intent here is now to reflect the actual burden cost, or a more accurate representation of the burden cost, and assign it to the annual budget. That's a large driver, if you will, of, I'm assuming, the benefits line at the almost 40% increase. The additional amount, I can't recall, well, it's almost 1.2 million increase over the previous year. That is meant to operationalize the PTSD so that next year the province will commence to be paying 50% of this year's. So then I will draw your attention to the bottom, rather than funding that directly from levy, because there is going to be somewhat of a bridge until we have our other major funding partner, that is the city and county's major funding partner of the province. Next year we'll be participating. So notwithstanding that same amount plus perhaps whatever COLA may be anticipated will be there next year. The province won't be picking up 50% of next year's, but they will be picking up 50% of this year's, and they will now begin to. So that ultimately, outside of COLA, I'm presuming that all things being equal, should actually see a reduction in the benefits line because of the participation now through the provincial one-time subsidy. So this is actually, I believe, doing what you're suggesting, Councillor Murphy. The problem is that we are not receiving the return on this investment until next year. So on that item, this has nothing to do with the overnight ambulance staffing issue. There were two issues that you raised, but I just wanted to be clear on the first issue with respect to PTSD. This is with an intent towards operationalizing that rather than covering it in 3 years' time. Now, following up your second concern once again, the ambulance?
Thank you, Mr. Chair. No, I totally understand the WSIB. I'm speaking directly to the salaries and benefits that are coming out of the Eganville base. I'd like an answer to that, please.
Okay, well, that I'll have to hand to Chief Nolan.
Thank you, Mr. Chair, and thank you for the question, Councillor. The question as it relates to how do we hit the 2.5% target in terms of the overall balance of our makeup, which is predominantly salaries and benefits. Certainly a portion of that, as you can see in the budget, is coming out of the WSIB reserve to be able to cover off that component. To be able to hit 2.5% with a balance of the costs associated with that, we are into service cuts as a demonstration of being able to hit the 2.5 if we don't take anything from reserve to be able to cover off the costs associated with that. And in fact, what I'm recommending in the conversation around is that we not cut, that in fact we actually need additional resources within the county. The problem that we're stuck with when we look at it from a data management perspective, not individuals, because we are as sensitive as anybody to what this means to the individual community or the individual who calls 911. But the reality is when we're sitting at 40% utilization in the daytime and 27% utilization at night, or said differently, we staff 10 ambulances in the day and 7 at night. That means each of our bases has 1 ambulance starting at nights, and each of our bases has 1 ambulance during the day, and Pembroke, Eganville, and Renfrew, because of the volumes in those areas, obligate an additional vehicle. The challenge with removing one of those vehicles during the daytime when we're at 40% utilization is we're not going to be able to service that demand. So if we're going to make a cut to be able to meet the 2.5% target, it should be happening at night. But that means because of the relative lower frequency of calls that come in, that means closing one of our base stations at night. When we look at our night dynamic, Eganville as an example, and I'm not picking on Eganville, but as an example, Eganville is partly covered off by Barry's Bay, it's partly covered off by Renfrew, it's partly covered off by Pembroke, incompletely and inappropriately. But if I was to take, for example, Deep River or Barry's Bay, which happen to be our slowest bases at night, there is no adjacency from 2 other sides of that catchment area to be able to cover that off. This is statistics. This is not meant to be a judgment in terms of which communities are haves and have-nots. It's a data analysis of the consequence of meeting the 2.5 based upon a reduction in salaries, which is the pressure that we've received to be able to meet that target. All the while, I've made clear that Eganville is actually an ideal place to not only enhance that service coverage area, but that should we reduce the service in that area, you can see from the heat maps that I've provided you, there's a significant geographic area which is then left uncovered. You can imagine almost all the way down to Northbrook and beyond in that geographic coverage area. So that presents a significant challenge for us in terms of reconciling the fact that we need growth when we've been asked to cut.
Follow up, Councillor Murphy.
Thank you, Chief, but I cannot support this budget. Thank you.
Thank you. Councillor Nicholson.
Thank you, Chair. Can I ask staff to move the slide presentation back to the heat map?
Deputy Grenier, I wonder if you could oblige, please.
Yeah, that one.
Thank you.
So I'd like to, like Councillor Murphy, I'd like to just divide this discussion up, if I could, Chair, on 2 aspects. One is the level of service and us recommending a level of service, and then trying to find the source to fund it. I'd like to stay with defining that level of service that's required. And when I look at this heat map, we aren't providing the level of service that we should to our communities. Regardless of whether it's rural or urban, we're going to have to steal from someone to support someone else. So from a level of service perspective, as the chief presented in January, we do not have the response capacity that I believe we need for Renfrew County. How we source that financially has to be the subsequent discussion, but I think primarily we need to come back to what is the level of service we want, and then how to fund it.
Thank you, and I think that is spot on. Whether this committee or any of the committees that are meeting this week is precisely that. It is always establishing what is the level of service that we believe our residents desire and can afford. And from that, then we have to determine what is the most efficient way of providing that service to the ratepayers. No question. With respect to and I want to reiterate, perhaps or simply echo the chief's comments. The intent, to be clear, was not with any pejorative notion of those who would be served out of the Eganville base. It is just trying to determine if, in fact, the 2.5% increase is what committee and ultimately council at budget workshop wishes to hold fast to. Then the options are precisely as are laid out here. So this is essentially giving this committee and council the information needed to make that determination. So like you, Councillor Murphy, and I believe that's what you were echoing as well, Councillor Nicholson, I am certainly not enamored of the notion of reducing service, and in fact have consistently been saying, I think for probably a year now, if not longer, that through the myriad vectors that community paramedicine has now delivered out into our community, whether it is palliative, whether it is long-term care at home, whether it is the clinics, etc., there are multiple avenues, multiple channels. So in addition to enhancing the service available to our community, what it has also done, has reduced the pressure on the legacy, or what we typically think of with respect to ambulance, that it is emergent response only. So it has actually suppressed, diminished, whatever adjective you wish, the requirements. But we've now utilized all of that capacity that we've provided, that the community paramedics have provided to themselves. And we are once again find ourselves with our noses pressed firmly up against the wall. And you can see the heat map. And just as Councillor Nicholson, you were suggesting, there are two green axes, and they are essentially the Highway 17 corridor and the Highway 60 corridor. And then we are seeing the response times diminish from there. So from my perspective, absolutely I'm not prepared to accept the notion of reducing where the substantial reductions, and I believe, Mr. Foss, you had suggested that the two in that second column from the left, i.e. on benefits and salaries, the 164 and the 370, are they specifically achieved through that reduction of the 12 hours? Is that correct?
Through you, Chair, the response to that would be 8,760 hours at the current collective agreement rate for the salaries, and that 8,760 is a 12-hour car. The benefits then are just simply a function of the salary reduction. That's correct.
Okay, thank you. So 116, 37, 530 is $500,000 there. So likewise, I am not at all comfortable, nor would our ratepayers, particularly in those areas that are in the red hues as opposed to the green, but I think that even those that reside perhaps in the areas that are seeing green service would absolutely expect that their more rural or remote neighbors are provided a much enhanced level of service, though recognizing that heat map is what we're seeing only with the current staffing level, deployment model. And there was a discussion, as you had suggested, Councillor Nicholson, at the January meeting of not simply relying on that same level of service, but we are now at that wall requiring a heightened level of service. So I'll throw it back to you, Councillor Nicholson.
Yes, Chair. So it's clear how much funds we need to find in order to maintain the current level of service, which is indicated by the map. But I'd like to know how much money is required in order to meet the recommended levels of service that were identified in January.
Okay, so I would have, once again, I would have to invite Chief Nolan, perhaps Mr. Foss. I don't know what the per ambulance cost would be if we were to move from the current 10 and 7.
If I could, Mr. Chair. Thank you. From a business case perspective, the addition of one ambulance, when I say that, I mean staffed with one advanced care paramedic, one primary care paramedic, 24 hours a day, equates to 17,520 operational hours for 24-hour day, 7-day-a-week coverage, which is where the conversation has been. And from a salary benefit cost perspective, that equates to roughly $1.3 million per year in cost. I was just asking Deputy Chief Leahy when the last addition, because the last addition that we had put additional ambulance hours on the road was actually the day car in Eganville, and that was over a decade ago. So just in terms of context, in terms of the investment on the 911 side of the house, all other investments that have occurred have been 100% provincially funded through the community paramedic community model, just for context.
Okay, thank you. I'll go now to Councillor Murphy.
Thank you, Chair. I'm just trying to do quick math here. So even, I recognize that we're a year behind, but this would represent, the 530 would represent, after provincial subsidy, just less than 1% on the levy. And what you're speaking of, no, I guess it would be less than that, but what you're speaking of, Chief, 1.3 would be about 3% on the levy, less provincial subsidy, so we'd be talking about 1.5% overall, which, I mean, I recognize that we probably aren't going to do this year, and it would require us finding ambulances as well, but I do agree with Councillor Nicholson that this is something that we need to look at. If you're talking a decade ago, it's probably time. Thank you.
Mr. Foss.
Thank you, Chair. Just wanted to follow up on Mr. Nolan's comments about cost for a 24-hour car. $1.3 million is salary and benefits for 17,000 hours. In addition to that, you've got to add to that sick, stat, vacation, training. You've got to buy an ambulance at $300,000. You have to operate the ambulance. So the cost is significantly higher than 1.3 million. You're probably at $1.8 million. If you stuck in the back of your head $2 million, it's probably a better concept.
Thank you. And what I would say is again, much like the discussion about PTSD, once this got into the budget, once again on a trailing basis, then the province would be participating. So whatever the costs would be ultimately are having, and I'm quite certain that Mr. Foss would say, okay, but the ambulance is going to be amortized over, I think it's a 5-year period, and the province treats us like a leasing agency. However, I think that those numbers are ballparks that are being provided for council's information. One thing, I just want to take a pause here because I would like if you could identify for me, Mr. Kelly, when Community Services takes over the room, because we haven't gotten to long-term care yet, and I expect that there's going to be some significant discussion surrounding that, and we're now an hour into our paramedic service.
Thank you, Chair. Well, they are scheduled to start at 1 o'clock. I would suggest, this is, you're hearing this budget today, obviously for your first time. The intent is to push it forward to next week's budget workshop. However, I'm hearing enhancements that you'll see in the budget enhancements we haven't considered although we may have talked around it, we haven't considered new ambulances, we haven't considered this. We also haven't, we're talking about, well, if not this, then what, right? We need to get to there. So if not the cut in a service level here, then what? And those will happen next week. But I would suggest if there is direction, we've got 6 days until the next meeting, a budget. If you would like any math done on an enhancement, I would like to hear a motion towards that today in terms of a direction of staff to bring those enhancements forward. Because what you are seeing, and we'll modify the recommendation a little bit to bring this forward, not necessarily approve it, but bring it forward for discussion. But if there's anything outside of the scope of then what you're seeing here today, I would like to see direction on that so staff can do some work in the 4 days that we have between then and now. Thank you, Chair.
Okay, and just before we do that, I'd like to set the parameters. So, as was discussed by Councillor Murphy, I am of a like mind that I am. It would be anathema to me to consider reducing the single ambulance over on the nightly basis. However, quite prepared for that, and I think it's appropriate that that go forward to the council in its entirety. What we're discussing here is if this committee wishes to add in an enhancement that council will then give consideration to at budget workshop, whether it would be approved or not, an enhancement or an expansion would be up to council. What I would suggest is don't forget that by the time we're meeting as council at the end of the month, 2 months have passed. Even if direction was provided to expand, I'm guessing on the earliest, on an annualized basis of perhaps Mr. Foss's 2 million, it's $1 million, because this thing is not going to get stood up overnight. But I think that's, if I'm not mistaken, that's what I'm hearing, is that be part of the draft for consideration at the budget workshop. Is that correct, Mr. Nicholson? Okay. Could I have a motion then to amend the draft, the draft emergency services budget to include costing as an enhancement the addition of a 24-hour ambulance, and I think that captures. So, and I think that should be kept as an enhancement in the column so that it is clear for council moving forward. Is that satisfactory, Mr. Nicholson, or Councillor Nicholson, sorry?
Yes, it is. Thank you.
Okay,
Chair.
thank you. Presumably, Councillor Murphy, you are prepared to second that amendment. Any further discussion? All in favor? Oh, sorry, Warden Emo.
So just the, so while that's going to be considered, are we going to be making a recommendation about the reduction in hours? Because I think what's going forward is the business case of a reduction of hours. And
I don't think the business case is talking about a reduction.
sorry,
of hours.
one of the budget pressures. So it sounded it sounded like we were not, the committee as a whole were not in favor of that. So that should be identified as well.
Well, my only suggestion, and that was why when I was setting the parameters of where we were moving forward on this, I did, in my inimitable fashion, well, perhaps it is imitable, I did tune in to the budget discussions of yesterday. And I believe that both of the committee budget drafts from yesterday are coming forward to council. I think it's appropriate for this to come forward to council because this is not the only committee that is seeing substantial budget pressures. And I think that would be appropriate. I am, as I had indicated, I am of like mind to Councillor Murphy, and I believe Councillor Nicholson as well, that I am not in favor of this, but I think that would be an appropriate conversation, Warden, for the council in its entirety, rather than to remove it at this point. Mr. Kelly.
And thank you, Chair, to the Warden and maybe to others. If there is direction to make it easier, then a longer conversation at budget workshop. If you disagree with there's really only a few pressure items that have been identified for it to be removed out of. Other committees have it scattered throughout. This is only a 2-pager. If you wanted us to consider service cuts or pressure enhancements in other locations other than this, then I'd like that direction then to do so from this committee. Said more simply, if you don't like this, then direct staff to find another way to find these cuts to make the 2.5 budget somewhere else. Otherwise, we'll be a little bit on our heels next week trying to do this, which is fine. We're used to that at Budget Workshop, trying to find other solutions, because we've only identified 3 or 4 different ways that we can find your 2.5% next week. If the direction is to go back to the drawing board, if you will, to find other ways to get this done, we will try our best.
Just before we enter that, though, I'm presuming in the entire process leading up to this budget, that was kind of the baseline that you were moving forward. I'm presuming what we're seeing is the result of tearing of hair and gnashing of teeth and clutching of pearls to have reduced ultimately to what is the most available to us. If staff, and we're speaking about specifically emergency services here, so we have the 2 deputy chiefs and the chief in the room, I am presuming that you have not left something on the table for the further negotiation, that you have gone down that road and tried to establish where it could be found. I'm going to guess that we could probably find some incremental savings on some different line items, but that aren't going to come close to the $500,000 that would be realized in this reduction. So I'm not sure that there's an entire value in arriving at that. And the only reason I'm suggesting leaving this on the table is if this committee removes this and it doesn't get in front of council next week, Councillor Murphy, you chair another committee. The other chairs are not present. I'm assuming that they would like to do a do-over and say, well, maybe we should have gone ahead and removed some of our budgetary pressures to get us down. Why is it that you've removed that from any consideration? That's why I'm suggesting that it advance to budget workshop. The reason I'm suggesting adding this other element is from the conversation that, and the map, as Councillor Nicholson has suggested. So we have not voted yet on the resolution before us to include as an enhancement the additional ambulance. But I would suggest if there's anything else that I'm hearing on the floor is not that we're going to find a cut somewhere else, but do we want to actually remove those reductions that are in that second column from the left right now? Councillor Murphy.
Thank you, Chair. And I would suggest no. I agree with your assertion that all the chairs and all the committees should see this document. What I don't like is the way the recommendation or the resolution is worded. I believe other committees use the word forward to Budget Committee, not recommend to Budget Committee, because it sounds to me like we are not recommending this, that we are simply forwarding it for consideration next week.
You actually have pointed out where I have yet a third time, as the Apostle Peter did, denied the CAO, who did advise me before we came to order today that we should amend that resolution and have it read before I open the discussion. So that one is on me, and just for committee's sake, that will be the rewording of this consistent with the 2 committees of yesterday, that in fact what we will be doing is forwarding, though we do have a motion to amend this right now that is on the floor, has not yet been called. The question has not yet been called, but then ultimately it would be to forward the amended draft budget. Okay? So that's clear. Yes, we are not approving this. We will be simply recommending it be forwarded to the budget workshop. So if that's clear with everyone, I'll bring it back to we do have a resolution on the floor. This discussion has certainly included whether we wish to find alternate locations for some savings. I think that would be probably an exercise in futility, quite frankly. And finally then, do we wish to remove the reduction on that 12-hour ambulance? And in my recommendation is no, that we carry that forward. If that is just by nod, if not by motion, because we really need to move on if we're going to get through this. So is that satisfactory? Does anybody have significant issues with proceeding in that fashion? Okay. Seeing none, there is a motion on the floor. Could you read that motion once again, Mr. Kelly?
Yes, sir. Through you to committee. The motion is to amend the draft budget, the draft emergency service budget, to include costing of additional 24-hour, 7-day-a-week ambulance service to the, yeah, there you go. That's it, period.
I would just, I think it would be appropriate to suggest on a beginning halfway through, something to the order of this is commencing for half this year, right?
We can do that too.
Like, obviously, it's not going to be ready for the start of the year. Is that satisfactory? Okay, thank you. Having said that, any further and final questions on this amending resolution? Seeing none, all in favor? That is carried. Thank you. Anything other of critical importance? Councillor Nicholson.
Sorry, I just add one other point, and that's just the replacement of our existing ambulance fleet. I took what the chief said there just about having to place the orders now or to secure it with a small deposit to ensure that we can have delivery in 2024 or 2025. Is there some creative way for us to be able to finance this for that future expense so we don't lose our place in line and have additional mileage on vehicles that we shouldn't, decrease in their capacity?
Okay, I see Mr. Kelly anxious to respond.
I'm so anxious. Through you, Chair, to Councillor Nicholson, and thank you, not to take anything away from the Chief. This is a broader conversation that I'd like to have because Public Works also has this issue, as do other departments, about ordering on a multi-year basis. We can come up with that plan. I think if I can suggest to park that idea for now, and perhaps we can address a little bit of multi-year budgeting, perhaps during the budget workshop next week, and where that can go. But that is a pressure amongst across other departments than just Public Works, or sorry, than emergency service.
Yeah.
Just if
Great,
I could, if I might, because I know that sometimes there may be arcane rules as to how these might be recorded. So. Because of the dynamic that is existing with ambulances, presumably also with Mr. Perkins's large vehicles, maybe even the smaller vehicles, but ultimately there is this lengthy time from order to delivery. Do we have the capacity, Mr. Foss, do we have to allocate the complete purchase price in a year that we are presuming to purchase these, or can we budget simply for the down payment costs in a current year with the delivery costs assigned to a future year?
Thank you, Chair. Maybe I'll draw committee's attention to page 37 of your package, because that is the list of capital equipment items that are being requested to be approved by this committee for paramedic services. About halfway down page 37, you'll see it's alphabetically, so we've got the paramedic group. And you'll notice that there are a number of laptops. There's a Polaris side-by-side being recommended. There are 4 ERV vehicles, which would be commander vehicles. There's a Ford Expedition being recommended. There's a Ford F-250 being recommended for this 2023 budget. And then you're going to see a bunch of items in yellow. And those items in yellow, 6, are 6 ambulances that we had ordered in the prior year that were not delivered in 2022. So they were in the 2022 budget. So we had fully funded plan for those, pulling the money from reserves to buy these ambulances, and we're not buying them. So what we've done then is those items in yellow have been rolled over to 2023. The money still sits in reserves. It's still ready to purchase these, but we couldn't get delivery in 2022. So those are the 6 vehicles then that we need a budget bylaw authorizing us to purchase and authorizing us to use funds to purchase the vehicles. So at the end of the budget workshop, when we approve the budget, it's that bylaw that will allow us to do it. You'll notice at the bottom, we have 5 other vehicles that were being considered for purchase this year in 2023. And what we've said in this document is we're deferring those to 2024. because there's no way we're going to be able to get those vehicles. So, essentially what we've done with these replacements is we've delayed the replacement of these 6 vehicles by 1 year. So instead of our 5-year replacement or 4-year replacement, we're going to extend the life of those ambulances by 1 year and attempt to service them to ensure that they're of the quality to remain on the road. So we do need a budget bylaw authorizing us to do anything more than those 6 vehicles in 2023. And if this committee wishes to add something to this to say that you want to make a down payment or you want to do something differently, we need the authorization from committee to proceed with this. As the CIO has mentioned, same issue in Public Works. We could take you to that portion of the document where we have heavy-duty trucks, snowplows, even light-duty trucks that have been delayed for a number of years because we can't get supply. It's getting better. Things are starting to turn around a little better, and my colleague can attest to that. But we've had those same challenges within Public Works, and we've had to extend the life of those vehicles by another year, service them to ensure that they, are able to perform their duties. But we've got this same issue in other departments. So if this committee wishes to do anything more than this purchase, we'll need to identify that and have that approved as part of our budget bylaw.
Okay, thank you. And I just thank you very much, Mr. Foss. And I'm presuming in the absence of any reason why we couldn't, because I just invited Deputy Chief Leahy. So those 4 that are in yellow, there was, he informs me, $450,000 was spent on the down payments in 2022, which should, I don't know how accurate the actual purchase price is going to be on these moving forward. I think that this is somewhat of a stale-dated purchase price, but there were funds allocated and spent in 2022 to ensure delivery of these in 23. And I think that that's perhaps what you're speaking to, Councillor Nicholson, is if we don't allocate any funds for these 5 at the bottom, if they're not if they're not provided any funds until the 2024 budget year, then we're not going to get them until 2025 if there still is this significant lag. Is that accurate, Councillor Nicholson?
Yes, thank you, Chair.
Okay, thank you. Councillor Murphy.
Thank you, Mr. Chair, and sort of putting on my automotive hat, I hope that everybody's budget, especially Public Works, has increased their repair budget line, because parts are going up, supply chain is terrible right now, and I would hate to see us in a position where we had 2 ambulances off the road or a plow truck or 2 off the road due to those issues. Thank you.
Okay, thank you. So they are, this schedule of capital, the schedule of reserves, this is also coming forward to it is not exclusive to health or to long-term care even more, ES more specifically, but this is going to be coming forward. Councillor Nicholson, do you wish to make a motion that the capital plan be amended to include some monies allocated to the 5 ambulances that are suggested not delivered until 2024 that will require an expenditure in 2023?
Thanks, Chair. I just wanted to go back to the CAO. He had mentioned that he wanted to have it in a parking lot. He might be able to come up with something else later. I'm prepared to do a motion, but if he has a better plan, I'm good with that.
Mr. Kelly.
Gee, thanks. Given that the same discussion should be had through you, Chair, that the same discussion, as Mr. Foss has pointed out, should be had with the Public Works as well, I think the motion would be best suited perhaps at the budget workshop overall, then rather than by committee of committee. Let's just hold that motion until budget workshop if you can.
Okay, then, and without resolution either, what I would suggest is we are hearing direction to staff to bring forward for consideration at budget workshop a process to procure some vehicles and equipment. Satisfactory? I think that's satisfactory. Okay, thank you. Anything More on the EMS budget. Okay, then we have passed the resolution to amend, so just bear with me one moment while I go back to the original resolution.
I have no problem repeating that for you, Chair, because I know it's been...
Well, we have voted on the motion to amend.
No, on the original
So what I had just stroked that out on mine, so what I have is recommendation that Health Committee recommends that the draft 2023 Emergency Services Budget as amended be forwarded to the February 22nd, 2023 County Council Budget Workshop for approval. Can I have a mover, please? Councillor McKenzie and Councillor Weir seconding. Wilmer, sorry, wrong mark. I'll get there. Councillor Wilmer and Councillor Weir, 2 W's. Anything further? Please, God, no. All in favor? That is carried. Mr. Blackmore, time for the speed reading. I don't know what time, and I do apologize for having so significantly eaten up not just our time, but we're soon pushing into lunch, but the floor is yours.
Thank you, Chair Donahue. I'm going to attempt to share my screen here.
Perhaps, Chair, just a little a note. So we do note that the Advantage Ontario webinar was to take place at noon today. For those registered, it will be recorded, and you can watch it after sometime this afternoon. Thank you very much.
Thank you. Okay, so yeah, just giving an overview of the long-term care budget for both homes. I'm going to get this out of the way so I can see. One sec. So just a bit of a preamble. As was the case last year, for those of you on Health Committee will recall that there was quite a bit of new funding added to the budget. And what that was representative was some we're going to see it repeat itself again this year, but with additional dollars in addition to some additional new positions being funded. So that accounts for a lot of the increases in the direct care staffing lines that you'll see throughout the budget. So that's in particular the RN, RPN, PSW staffing supplement, allied health professional staffing supplement, so your physiotherapy, dietitians, that sort of thing. Nurse practitioner provincial fund, which we're able to tap into this year to fund a full-time nurse practitioner at Bonnechere Manor. IPAC professional fund, so that was funding for each home to have its designated infection prevention and control RN on staff. PSW permanent wage enhancement, so that's a $3 an hour that was added to the PSW that you're familiar with, that was made permanent this year. So in terms of dollar figures and hours, so that staffing supplement for RN, RPN, and PSW for the manor equated to an additional 29,384 hours to the baseline, an increase of $863,314. For Miramichi Lodge, an additional 25,271 hours with a budgetary increase of $796,168. And this additional funding is aimed at getting homes across the province closer to their 4 hours of care per resident per day. Budgeted last year for Bonnechere Manor, that budgeted figure brought us to 3.93. For 2023, this brings us to 4.38 hours. And that's important to note that that's paid hours versus worked hours. So that's inclusive of vacation, holidays, sick time, all that stuff. And versus actual hours, which is a bit of a different story at the moment, given we are experiencing some significant staffing challenges at Bonnechere Manor. So Miramichi Lodge, our budget, our budgeted hours brought us to 3.96 for last year and projected at 4.38 with this upcoming budget. For Allied Health, we saw a monetary increase of $40,694 for Bonnechere Manor and $37,529 for Miramichi Lodge. And how we utilized that funding was a physiotherapist at Bonnechere Manor. We converted from a part-time to a full-time. We have a new social worker at Bonnechere Manor. We converted a part-time to full-time dietitian at Bonnechere Manor. And as I said earlier, we engaged a second nurse practitioner using the NP funding, and actually we realized the savings to the county on this one, because up until this point in time, the nurse practitioner fund, or existing one, was not fully covered by the province. So we were able to dip into Allied Health to make up the difference. So at a savings to the county for both NP positions, essentially 100% funded. Additional funds, I'd mentioned earlier the infection prevention control fundings. So for Bonnechere Manor, an additional $45,724. For Miramichi Lodge, an additional $42,168. The permanent PSW enhancement, the wage enhancement at $3 an hour, $450 for OT plus benefits. So that equated to roughly $611,614 for the manor and $521,429 for the lodge. And just to give an overview, and it's been touched on previously, just this idea of what it is we're trying to achieve today with this 2.5%. So it's essentially, it's having undergone the exercise with the management team, and thank you to Mr. Foss and Mr. Burke for their help in getting us through this as well, to present a budget to you that presents what it is, not that we want to give up everything we do is essential in my opinion, but where we could give up something, what would it be in order of priority? And then what comes before you now is a bit of that. So that represents a budget pressure of $162,000 for Bonnechere Manor and a budget pressure of $64,000 and $467 for Miramichi Lodge. And just in terms of what that means in terms of an unchanged service variance, so like i.e. if we were to keep our current service levels, what would that mean? It's roughly a 13.5% decrease in that service level at the manor and a 7.7% decrease in that service level for the lodge. So these are the things we looked at reducing, and these are ones that are common to the home first, both homes first. Number one being client programs. It was the elimination of special resident functions funding for those that funding's used primarily for outings outside of the home. A cut in resident recreation and entertainment. So it seems kind of ironic in that here I am just previous announcing all this additional funding that's coming our way, millions of dollars. But they're tied specifically to funding, and you can only use it for funding, so you have to demonstrate an increase in staffing, rather. So that's fine for staffing, assuming we can recruit that staffing, but it's all the other ancillary type things that there's no increase in funding named for. An item that we're looking at reducing specific to the manor, having a higher deficit, was some reduction in some equipment replacement for recreation and hobby crafts. And this is represented on page 22 of the Bonnechere Manor report. The items in blue are unique to the manor, as I'd mentioned earlier. The yellow are common to both homes. Just for your viewing. And that same, what I just mentioned, that same report is available on page 29, indicating what the reductions for the client service programs for Miramichi Lodge. The next thing we looked at as a potential to cut was laundry and linen services. So we're cutting bedding replacement by 37% at the lodge and 39% at the manor, and that's represented on page 26 of your manor report, page 32 of the lodge report. Administration, both homes, we're looking at cutting recruitment advertisements and leaning more toward digital advertising and web-based advertising. 100% decrease in print costs, decrease in conventions by 100%. For example, the Advantage Ontario convention that's coming up, and clinician type conventions that do appear as well, and cutting staff training by $10,000 per home. Bonnechere Manor specific to get us to over the hump with that additional deficit that they have. We're looking at equipment replacements, cutting by 100%. Health and safety program, lunches, the initiatives, cutting by 100%, and a 67% cut in travel. And those can be found on page 26 of the manor report, blue unique to the manor, yellow common to both homes, and page 33 of the lodge report. Cuts to specific to Bonnechere Manor and food services. So we're looking at cutting out replacements of carts, tablecloths, like small pieces of equipment, cut by 100%. Cutting out the holiday dining decorations and cutting down by 47% replacement of worn out or broken cutlery dishes, what have you. And that's captured on, I don't have the page here, food services of the Bonnechere Manor report. Again, unique to Bonnechere Manor under building and maintenance, property maintenance, cutting the expenditures on resident common area furniture replacements, as well as cutting our purchase services by 3% and by way of things like snow removal, landscaping, lift testing, alarm testing, elevators, things like that. And that's reflected on page 26 of the Bonnechere Manor report. And something, a bit of a pressure relief strategy. We're running into some issues at both homes with regard to our Wi-Fi, connectivity, sharing broadband, and that most residents coming in these days they have iPads. They watch Netflix, and 166 Netflix watchers, or one at the lodge, or 180 at the manor. It's having detrimental effects on our broadband abilities. So we'll be looking at creating a separate stream on a pay-for-service basis for the higher bandwidth type services. Another pressure relief initiative is that of what we established some years ago. It's called the CMI Stabilization Fund. So essentially what that is, well, up until this past year, for years, homes funding has been determined by the case mix index, which essentially is an equation to determine what's the average care level for your resident times your number of residents compared to the rest of the province. Here's some money for that, for which was frozen last year, and to the detriment of Bonnechere Manor in that it was probably one of their highest, like if our actual CMI running right now that determines care acuity, which funding would be tied to, is at its highest level than I can recall. We're actually over 100 now, whereas we're frozen at 87. Miramichi Lodge gained a little bit in that we had a slight drop in our what would be our actual CMI. So anyway, to counteract those effects from year to year, we've established a reserve fund to get us over the hump we've shared between homes. So we're proposing to utilize $71,272 of that reserve fund to cover off a portion of Bonnechere Manor's deficit to achieve that 2.5%. And just as a matter of interest, the balances on those particular funds right now for Bonnechere Manor is $248,242 in that reserve, and Miramichi Lodge $100,614 in that reserve. That's in a nutshell.
Okay, thank you. Unlike the last time, I'm going to read this resolution first. I will finally do something that you have asked me to do, Mr. Kelly. Recommendation that the Health Committee recommends that the draft 2023 Bonnechere Manor and Miramichi Lodge budgets be forwarded by this committee to the February 22nd, 2023 County Council Budget Workshop for approval. Can I have a mover, please? Warden Emo, seconded by Councillor Grills. Discussion. Councillor Murphy and then Councillor Nicholson.
Let's just cut to the chase. We're not cutting out holiday dining decorations. Did you see everybody's face when you said that? Definitely some discussion points going forward to budget workshop. Thank you.
Councillor Nicholson.
Question, Chair, just on, I understand that some of the funding that's stovepiped for the province specific to staffing. Is there any flexibility internal specific to staffing? I.e., if we have a vacant position that we're funding, can we reallocate that savings to fund some of those things like have been pressure reduced. Is that feasible?
Mr. Blackmore.
Through you, Chair, to Councillor Nicholson, the staffing funding that we get is specific to a position. So it's like the supplemental funding, that's RN, RPN, PSW. The allied health, that's physio, those types of things. Yeah, they're all spoken for, and our challenge right now is utilizing that funding, to be frank, in terms of recruiting to use it.
Follow-up, Councillor Nicholson.
Sir, again, and just to make sure that I completely understand it, if we've got an RN position that's funded through some other funds, and an RN position that we fund, I don't know if we do, but we just want to make sure that we're maximizing the outside funds and going vacant internally, so we can keep that. Okay, I appreciate that. Thank you.
Just for the record, and I'm not sure the camera, Mr. Blackmore was nodding vigorously in affirmation. Councillor Weir.
Just need some, through you, Chair, or Chairperson. Lift testing was mentioned in there. It was within that 3% reduction. Just to clarify for me, is the lift testing the mechanisms that we use to lift people from their beds and transfer to chairs? And if we reduce that, what is the outcome to us if that lift doesn't work when we have somebody in transfer?
Yes, through you, Chair, to the Councillor. We are obligated to maintain a certain level of lift testing, and to be honest, looking back at that, it was in a stream of things that would be covered. The lift testing, for sure, we would maintain whatever the minimum requirement is for that particular lift. So it was in a line item that probably should have taken out.
Okay, thank you. Just concerned about the safety issue of that.
Okay, thank you. Councillor Purcell.
Through you, the Chair, to the Director of Long-Term Care. In regards to the health and safety programs and the cuts to the health and safety line, I see that was the entirety of the 100% budget. What would that line consist of typically in terms of the services that are provided through that line?
Through you, Chair, to the Councillor. It's more incentive-based. There's funding set up for like health and safety dinners, prizes, that kind of thing, versus we still are obligated to carry on with our health and safety meetings, minutes, those types of things, and do our inspections. Those things would still continue. It's more of an incentive program to foster the health and safety program.
Thank you. Anything further? Just one that I have, Mr. Blackmore, and this is kind of perhaps a 30,000-foot level. So if I'm understanding kind of the PowerPoint presentation, and we've been aware that we are moving rapidly towards this ever-elusive increased level of care, hours of care, it seems to me that you were suggesting that a lot of, if not completely, that the province was picking up the cost of that. So I wonder if you could just broadly suggest, I note that I'm seeing significant benefit increases where salaries are, I'm just looking at the nursing services at the Manor, that's the page that I'm on. So salaries are going up 17% and benefits are going up 37%. Now in this instance it says it's direct care, so I'm presuming that that's funded by the province, but that we're contemplating, assuming a Grinch-like approach towards entertainment, et cetera. What is driving those cost pressures that is not being laid off on the province, but in fact is now being contemplated in the levy dollars that is driving us to have to consider some of these, what I view as draconian measures? Just a sense of where we're really seeing increases that are driving this offset to meet the 2.5.
Chair, are you referring to like the variance between the benefit versus salary, or?
Well, if we're looking at, I'd have to go back to the overall long-term care, but of what the shared, so I'm having the unchanged. So the Manor is 13.5 and Miramichi Lodge is at 7.7. So those aren't being driven, as I understand it, by the enhanced care that the province is now funding, IPAC, PSW, et cetera. So outside of what has been typically the 2.5% year-over-year increases to operations at each of the lodge and the manor, what is driving those baseline level of service cost pressures that we're contemplating some of these significant cuts?
Chair, I'll take a first stab at this, but I'll look over to Mr. Foss to help me out. But my understanding is that quite a bit of this is to do with the rate variances between the two homes when it comes to benefit.
Okay, Mr. Foss, and my intent is not to minimize, a complex budget, but we're seeing this year is significant outlying. We've seen what it is driving, largely what it is driving it in the paramedic service. I'm curious if there's like one or two things that you can say, here's what we're experiencing that's driving this.
Thank you, Chair. I think maybe what I'll do is, again, just point your committee back to some numbers. So page 28, just taking Bonnechere Manor, for example, and I think the question from the chair is essentially, we've kind of set a goal to say it's 2.5%. That's what we're trying to work with as far as municipal dollars go. And what's really driving the cost pressures where we have to kind of make some reductions here and there. As my colleague, Mr. Blackmore, indicated, we've got a lot of new money coming into both the homes. We got $800,000 in new provincial subsidy coming into Miramichi Lodge. We have $900,000 coming into Bonnechere Manor because it's based on that model of increasing to 4 hours of direct care per resident per day. However, we don't get that money unless we spend it. It's dollar in and a dollar out. There are no dollars left over where we can hang on to for any other purpose. So salary and benefit costs increasing, 100% offset by this new money that's coming in. So when I draw your attention to page number 28, and I realize there's a lot of money, but the group of revenues at the bottom that says provincial subsidy, and you'll see the very top line says operating subsidy. That's our base subsidy, our CMI subsidy. So here's how much the province gives every home per resident per day for nursing and personal care, for food, for other accommodation. And you'll see that the calculation that we get from the province for our base funding, not the extra new money, has gone up by 1.4%. It's $134,000. That's it. So that's our struggle, is that the province is giving us $134,000 and saying, why don't you run your home with that? And if you look on the page prior to that, page 27, you'll see that last year's budget, our total expenses are $17.7 million in expenses. So even if we went up by a couple of percent, that's a $400,000 increase in our cost, our base cost, and the province is giving us $134,000. So we're in this squeeze, and we can't use the new money to cover our base program. We can only use the new money to enhance our staffing complement. The biggest challenge that Mr. Blackmore has is we've been trying to enhance our staffing complement for years and years and years. And it won't be a surprise to anybody at this committee that there is an incredible healthcare workforce shortfall that we're all scrambling trying to get access to very scarce healthcare employees, especially in Renfrew County. So although the budget, provides for, we're getting all this extra money for these enhanced care, the biggest challenge is where we're going to find those people to provide it. So in the model, the funding model is if you don't spend the money on new and extra paid hours, you don't get to keep that money. It all goes back to the province of Ontario. So I think, in a nutshell, and why Mike is scrambling to find some reductions to get to the 2.5% target, that's exactly what's happening to him. Not only in Bonnechere Manor, but also in Miramichi Lodge. The base funding really isn't sufficient to take care of the fairly significant cost pressures that he's got in long-term care. Extra money's wonderful, but we can't hang on to it. We have to spend that on extra employees. Thank you.
Thank you very much for that, Mr. Foss. And ultimately, from my perspective, what it does is it distills. If we were in an environment that we were simply business as usual and not expanding our services, I assume that our discussion on long-term care we would be screaming from the rooftops of how is it appropriate to only be providing an additional 1.4% to our year-over-year operations in the midst of the inflationary pressures that the province is seeing. It is somewhat obscured by the fact that there are wheelbarrows of money being wheeled up to the door, but they are under lock and key, and in fact are not available for anything but the expansion. So in fact, if these are being housed perhaps in a plexiglass locked building, we can see them, but we can't use them, though we know that our cost pressures just on a year over year. Committee may be familiar, when large retailers are providing their annual financial statements, they talk about same sale stores because their sales might go up by 100%, but they put up 100% more stores. So it's not reflective of an increase of sales, it is more volume. And it's akin to that. This is being disguised somewhat. That's probably overstating. I don't know that it's necessarily by commission, but more by omission. The fact that they are channeling a lot of money through certain specific envelopes should not obscure from the fact that they are actually robbing some of it from a different pocket, and I think that is an enormous challenge, and I think probably not to tie that into budget today or at budget workshop. Perhaps at the end of the month, this might be appropriate for the warden to give consideration to a letter expressing our dismay at the position that has been adopted by the province. In any event, I appreciate that. That's what's driving us considering taking away all of the lollipops from the dish at the front desk. Anyway, anything further? We have the resolution before us. I think I got Mr. Kelly.
The only thing I would suggest here to you, to committee, before the recommendation to move this forward, I would suggest that you hear the one item we have to address in closed. Okay. It is pertinent to moving this forward in this current state. So I would suggest going into closed, leaving this motion on the table, go into closed, and then deal with this motion when you come out of closed.
So just correct me, Ms. Hill, has the motion been moved and seconded? So it is on the floor, it is in possession of the body. Thank you for that, Mr. Kelly. With that, then, I would seek a motion to go into closed session, please. Warden Emo, seconded by Councillor Wilmer. All in favor? That is carried. Give a few moments for all. Welcome back, everyone. Thank you for your patience. We have now concluded items 7 and 8. You will note, committee, that you have attached Board of Health minutes from the December 16th, 2022 board meeting.
Chair, sorry, you're missing.
You need a vote on the...
Oh, correct. Apologies. Yes, apologies. Once again, I had failed to heed Mr. Kelly. With that, we have before us the resolution to forward the draft budget to workshop next week. Can I seek to call the question, please? All in favor? That is carried. Thank you. With that, now going to item number 9, the Board of Health minutes, as indicated from December 16th of last year, January 10th of this year. They are before us. I would seek a motion to, I believe, receive these minutes, please. Councillor Grills, seconded by Councillor Yan. I'm pretty sure I could see your hand up there. There it is. Any question or comment on the minutes? Seeing none, all in favor? That is carried. Thank you. Any new business for the committee? I see none. We have accomplished the closed meeting. The date of our next meeting shall be Wednesday, March 8th. An adjournment, please. Motion to adjourn. Councillor Weir, seconded by Councillor Wilmer. All in favor? Made it. That is carried.